And we are going to go ahead and get this session started, and we will begin with two proclamations this morning. Our first proclamation will be presented by my colleague, Councilmember Katz, and it's a proclamation recognizing the 73rd anniversary of the Universal Declaration of Human Rights. Councilmember Katz, you're on.
Thank you very much, Mr. President. And good morning, Mr. County Executive as well. He's here for the next proclamation. I had the honor this morning in presenting the Universal Declaration of Human Rights, the proclamation for it, and it recognizes, as you mentioned, the 73rd anniversary adaptation of the Universal Declaration of Human Rights, also known as UDHR. And we are here this morning not only to acknowledge the important impact of UDHR and the impact it's had in the world, but to also raise awareness of the human rights in Montgomery County's role in helping to enshrine these rights in action at the local level. We are truly honored to have, accepting the proclamation, two great-granddaughters of Eleanor Roosevelt. Anna Fierst, a board member of the Eleanor Roosevelt Center at Val Kill, and she is a longtime Montgomery County resident, and Juliana Roosevelt, who's a human rights advocate. Eleanor Roosevelt had an unwavering commitment to passing the UDHR and a lifelong commitment of promoting the dignity, equal, and inalienable rights of all members of the human family. The work is being carried on by members of her family, along with not-for-profit organizations, such as the Eleanor Roosevelt Center at Val Kill, and their desire to inform the world of UDHR. The Universal Declaration of Human Rights is a milestone document in the history of human rights. It was drafted by representatives with different legal and cultural backgrounds from all regions of the world. The Declaration was proclaimed by the United Nations General Assembly in Paris on the 10th of December, 1948. That was General Assembly Resolution 217A, as a common standard of achievements for all peoples and all nations. It sets out for the first time fundamental human rights to be universally protected, and it has been translated into over 500 languages. The UDHR is widely recognized as having inspired and paved the way for the adoption of more than 70 human rights treaties applied today on a permanent basis at global and regional levels, all containing references to it in their preambles. The Eleanor Roosevelt Center at Val Kill is a national leader in youth leadership and character development programs, human rights education, and advocacy initiatives that inspire and empower individuals, organizations, and communities to use their time, talents, and resources to build a just and sustainable world. We're dedicated to the breathing new life into the present set and the legacies left behind by the First Lady of the world, Ms. Eleanor Roosevelt. We strive to be Eleanor Roosevelt's heart, mind, and voice in realizing a better world, a world of acceptance, opportunity, dignity, and respect for all. And with your indulgence, Mr. President, I'm going to, before I read the proclamation, I'm going to ask Ms. Fierst and Ms. Roosevelt for their comments.
I'll take myself on. I think you can hear me now.
Okay.
I just want to thank so much the County Council, Montgomery County Council, for putting this forward, this proclamation, and public recognition of the UDHR and the importance of it to human rights around the world is extremely important. And I know that the people at the Eleanor Roosevelt Center for Val Kill are very appreciative, and this recognition is extremely important in public settings like this to promoting the values of the UDHR. So thank you so much to all of you who were involved in bringing this forward. And that's all I have to say. Thank you again.
Thank you. And Ms. Roosevelt.
Thank you. Well, I'll echo my cousin's words, but also say there couldn't be a more important time for involvement in helping to disseminate the words and the intent of the Universal Declaration of Human Rights. And you are joining many, many cities throughout this country who have issued proclamations and are dedicating themselves to promoting awareness of the Universal Declaration of Human Rights. So we thank you very, very much.
Thank you both for joining us today. Let me read the proclamation. It's from the Montgomery County Council. Whereas on December 10th, 1948, thanks to the moral leadership and dedication of Eleanor Roosevelt as the first chairperson of the Commission on Human Rights, the world took a major step forward with the creation of the Universal Declaration of Human Rights, UDHR. And whereas the UDHR enshrines the human rights and fundamental freedoms inherent in all people, no matter who they are, where they come from, or whom they love, it is a foundational document that proclaims a truth too often overlooked or ignored, that all human beings are born free and equal in dignity and rights. And whereas just as the nation advocated for the recognition of universal human rights following World War II, Montgomery County today remains steadfast in our commitment to advancing that human rights of all people and to leading not by the example of our power, but by the power of our example. And whereas working together, residents of Montgomery County recommit ourselves to promoting respect for human rights here and throughout the state, to honestly discuss the challenges we face and to identify meaningful new actions and commitments to advance our shared goals. And whereas we are reminded of Eleanor Roosevelt's words that human rights begin in small places close to home, so close and so small that they cannot be seen on any maps of the world, yet they are the world of the individual person, the neighborhoods we live in, the schools or colleges we attend, the factory, farm, or office where we work. Such are the places where every man, woman, and child seeks equal justice, equal opportunity, equal dignity without discrimination. Unless these rights have meaning there, they have little meaning anywhere. And whereas to recognize and honor the work of Eleanor Roosevelt's contributions to human rights and the commitment of the Eleanor Roosevelt Center at Val-Kill to further her legacy of social justice, now therefore it be resolved that the County Council of Montgomery County, Maryland, hereby recognizes January 11, 2022 as Universal Declaration of Human Rights in honor of Eleanor Roosevelt's legacy of promoting the dignity and equal and inalienable rights of the members of the human family. It's presented today. It's signed by the Council President, Gabe Alvarez, and by me. Thank you very, very much for all that you do. And with that, Mr. President, I'm turning it back over to you.
Thank you very much, Councilmember Katz. The next proclamation will be presented by the county executive and myself, and Councilmember Hucker is requested to say a few words regarding this important proclamation as well. Just a moment. This is a proclamation recognizing Human Trafficking Prevention Month by the Council President and again the County Executive, and we will be hearing from Councilmember Hucker as well. This is a critically important issue. One of the first constituent issues that my colleagues within my office had to address was a woman that contacted us that was the mother of a family of with 4 children, and she, unbeknownst to her, was undocumented. Her husband had been holding over her the entirety of her time in the United States, her immigration framework, and this was a form of human trafficking. This woman had been seeking a divorce. There was tremendous domestic violence going on within the household, and she was desperately seeking help. We were able to align her with services, but it underscored the fact that human trafficking takes on many forms and is right here in our community and must continue to be a focus for us to be able to address it in a way that is meaningful and impactful. County Executive Elrich, I'll ask you to say a few words as well.
Yeah. It's totally fitting that we're doing this the same day we're recognizing the Human Rights Declaration. It's probably one of the greatest violations of human rights is the traffic in human beings. And January is Human Trafficking Prevention Month, and we're dedicating this month to raising awareness. The county's Human Trafficking Prevention Committee is dedicated year-round to making a difference. This isn't a one-day thing. This is something we work on every day. Committee's divided into 3 subcommittees: education, outreach, victim services, and legislative. The legislative subcommittee is currently working with the state task force to create legislation to assist victims and survivors. The victim services subcommittee is currently working to enhance the county's response to victims, and the education and outreach subcommittee spearheads all the educational activities, including training of community groups and county agencies. The work of these committees is really imperative to reducing and preventing trafficking, and we're going to continue to do all we can on our side of the street to make sure that we fight this in every way possible. I share with the council president memories of the discussions about this early on and the many ways that human trafficking took shape. People who came over and thought they were working for somebody and discovered they were basically prisoners inside the houses and threatened with deportation if they said anything about their condition. We continue to see incidences of children being involved in trafficking as well as adults. It's very heartbreaking, and it's a real crime, and we're treating it as a real crime. And we want to just make sure the public recognizes the science of human trafficking and that people know they can come to the county government and get help and help those who they think are victims of human trafficking. So thank you for inviting me here this morning, and look forward to the proclamation.
Thank you, County Executive Elrich. Councilmember Hucker.
Thank you, Council President. I know all of us mourn the fact that we have to rededicate ourselves to this work every single year, but that shouldn't stop us from celebrating the great individuals who are here today and so many that can't be, who are engaged in this struggle. I'm proud to have worked with Councilmember Rice and many of the advocates here today and others to have passed 2 state laws on this topic and 3 that deter the human trafficking in our county, unfortunately. One that requires the license to operate a bodywork establishment, which we still need to strengthen, I believe. One that makes purchasing prostitution, I'm glad Jody is nodding, one that makes purchasing prostitution a violation of county law, and the third that turned, sadly, our task force into a permanent commission because this work seems like it's never done. Everybody should know the pandemic has only exacerbated the conditions that make individuals vulnerable to trafficking. Like so many other problems. We see more unstable living conditions, more individuals who have caregivers or family members who have a substance abuse issue. We have so many of our residents that are undocumented immigrants and are facing poverty and economic need and are runaways, unfortunately, and often have a history of sexual abuse or addiction. If we're serious about training our equity lens on all the issues before the county government, we have to apply them to human trafficking, which heavily affects our immigrants and our people of color. I'm very glad we're recommitting ourselves today to combating this issue, which has impacted so many lives across the county and across the country. I hope we're going to support the Safe Harbor Bill in Annapolis, sponsored by our own Senator Susan Lee and Delegate Learman, to give immunity to any minors who are charged. That's something we've needed for a long time. But while we keep an eye on the future, I really want to celebrate the efforts of the Human Trafficking Prevention Commission and thank them for all their dedication. I know they'll be named by the council president, but I see each of you and I'm grateful for all your hard work on this and look forward to your continuing partnership. Thank you so much.
Thank you, Councilmember Hucker. Next, we will hear from Ms. Jody Finkelstein.
Hi, good morning. It's an honor to be here. I'm going to defer my time to our Vice Chair, Wendy Stickle, and also quickly want to introduce Debbie Feinstein, who's also part of our committee with the State's Attorney's Office. Unfortunately, our fantastic Chair, Erin Andrews, wasn't able to join us today, as was our other member of our Executive Committee, Jessica Volz. But I did want to thank both the outstanding Erin Andrews and Jessica for all of their outstanding work. Wendy?
Thank you, Jody, and thank you all for having me today. Thank you also to County Executive Elrich and the County Council for this proclamation that you will be presenting today and your continued commitment to combating human trafficking in Montgomery County. The Montgomery County Human Trafficking Prevention Committee has been working hard throughout the pandemic to raise awareness on this important topic. Over the past year, the committee has focused on assisting with the Children Fleeing Violence Newcomers Stakeholder Committee. Collaborating with the University of Maryland Safe Center, we continue to provide human trafficking training to all of those stakeholders who ask for it. We've also been working with the Montgomery County Public Schools to enhance their human trafficking student curriculum. In honor of Human Trafficking Awareness Month, the committee is collaborating with the UMD Safe Center, Amara, and the Prince George's County to put on 2 different virtual trafficking seminars open to the community. We are also running a social media awareness campaign. This spring, we will host a poster contest with MCPS students to help raise awareness. Human trafficking is occurring in Montgomery County. Both sex and labor trafficking have become more difficult to identify throughout COVID. At the same time, potential victims have become more vulnerable as food and housing insecurities fail to dissipate. With the support of the county executive and the county council, we hope to work together to create smart policies and practices to protect all of those living and visiting Montgomery County and the DC region from exploitation. Thank you again for having me.
Ms. Feinstein.
Good morning. I wanted to thank everyone for their work, and it's certainly a privilege to be a part of the Human Trafficking Commission and to engage in this work. As Councilmember Hucker said, this work unfortunately doesn't end. It's a daily struggle, it's a daily fight, and I want to commend our Montgomery County police officers that are engaged in this work and the detectives and the Vice Unit for the hard work that they do each day to try to root out trafficking in our community, and of course, all the incredible advocates and the partnerships that we have with so many different service agencies that are really doing the work of healing and helping victims of human trafficking. And thank you for acknowledging this important issue and for continuing to engage in the education and prevention work so that we can combat it in our community.
Thank you to the 3 of you. The Montgomery County Commission for Women and Community Advocates have paved the way to shelter those most directly impacted by the horrific impacts of human trafficking, and have really worked hard on helping to implement for inflicting gruesome trauma upon these victims. So your vision, your fearlessness, and your leadership have been truly extraordinary and exemplary, and I just can't thank the Commission enough for all of its incredible work. So thank you all. The county executive and I will now read the proclamation. Mark, I'll get us started, and then you can read the second phrase from there. You have the proclamation before you.
Yep.
Perfect. Proclamation of Montgomery County, Maryland. Whereas human trafficking is a form of modern-day slavery that is a serious problem in Montgomery County, where traffickers use violence, threats, deception, and other manipulation tactics to force and coerce adults and youth to engage in commercial sex acts or to provide labor or services against their will. And
whereas COVID-19 has not eliminated trafficking, but rather forced it to go more underground, with unemployment, housing crisis, and inflation that have made individuals more vulnerable and therefore more prone to being trafficked. And
whereas human trafficking disproportionately impacts racial and ethnic minorities, women and girls, LGBTQI individuals, vulnerable migrants, and other historically marginalized and underserved communities. And our mission to combat human trafficking must always be connected to our broader efforts to advance equity and justice across our society. And
whereas growing awareness of supply chain issues offers an opportunity for Human Trafficking Prevention Committee to expose how nearly all residents contribute to the demand for human trafficking and what residents can do to reduce their demand. And
whereas January is Human Trafficking Prevention Month, which formally recognizes that human trafficking consistently occurs in the United States and emphasizes the need for the public and private sectors to come together to focus on prevention, prosecution, partnerships, and support for survivors. Now, therefore, be it resolved, Mark Elrich as County Executive and myself as Council President of Montgomery County, Maryland, hereby proclaim January 22nd as January 2022 as Human Trafficking Prevention Month. In Montgomery County, Maryland, And we call upon businesses, civil society organizations, communities of faith, families, and all Americans to recognize the vital role we play in combating human trafficking and to observe this month with appropriate programs and activities aimed at preventing all forms of human trafficking. Signed on this date by myself and the county executive. Thank you all so much again for joining us this morning. We appreciate your really, really impressive work. Have a wonderful morning.
Thank you.
Thank you.
So with that, we are 9 minutes ahead of schedule here. So we are going to begin our general business discussion promptly at 9:30. We'll see you all then.
Good morning.
Good morning, Council Vice President Glass. How are you?
I'm well. How are you, sir?
I'm okay.
Good morning, all.
I got a touch of the
I am not firing on all cylinders.
That is nothing more than a.
Yeah, that makes two of us. All right, I've got 9:30 if you can count us in, Equin. Good morning again, everyone. Before we get to general business, the council is partnering with the Montgomery County Historical Society to do something called the History Minute. I am a big history buff myself, and I feel it's so important for us to honor and recognize those that came before us and helped establish Montgomery County to what it is today. Today, we're going to be profiling a gentleman named George Meads. The town of Rockville's first fire chief was a black man named George Meads. Though two segregated volunteer fire companies, one white, one black, were appointed in 1895 at the direction of the mayor and town council, it appears that the Black Brigade was the only continuously active volunteer fire company in Rockville from 1895 through 1920. By 1896, Mr. Meads was named chief of the volunteer fire department and is often credited as the only man mentioned as the one in charge of fighting fires. Other black volunteers included Henry Shelton, Henry Dibby Herbert, Tom Herbert, Cornelius Joy, William Proctor, Henson Martin, and of course George Meads Jr., and at least 30 other men. In a summary of Rockville Society published in 1900, the Baltimore Sun stated, "Rockville has an excellent fire department. George W. Meads is the chief of the department, which consists of but one company." It also states that their equipment consisted of a chemical engine, a ladder truck, and a hose reel purchased by the town for a whopping $1,450 in August of 1895. Mr. Meads passed away in 1919. But in 1921, after a serious fire at Collins and Store threatened nearby businesses, the mayor and town council founded the official volunteer fire department after that. But Mr. Meads is credited with establishing a legacy of first responders in our community. So today we recognize Mr. George Meads. We now move on to general business. Madam Clerk, are there any announcements?
Good morning, Council President, Council Vice President. There is one announcement. Public hearings on the FY23 capital budget and capital improvements program will be held on Tuesday, February 8th, 2022 at 1:30 p.m. and 7:30 p.m. and Wednesday, February 9th, 2022 at 1:30 p.m. The Council has not received any petitions today, Mr. President.
Thank you, Madam Clerk. I now am going to be reading a statement. This is a statement on the December 29th, 2021 opinion of the Open Meetings Compliance Board. The Council appreciates the work of the Maryland Open Meetings Compliance Board for their diligence in finding that the Council's closed session discussions on March 9th and May 12th were properly held within the relied upon exceptions permitting a closed meeting under the Open Meetings Act. The board, in its decision dated December 29th, 2021, also found deficiencies in the detail described in some of the closing statements for a closed meeting. Some of the closed sessions minutes, some of the summary of the closed sessions in the open meetings minutes, and the timeliness of approving some meeting minutes. The council takes these matters very seriously, and we plan to use this decision as a learning experience. We have asked our attorneys to review these issues with council staff to ensure they are promptly addressed and provide as much transparency as appropriate for future closed sessions. The council has not received any minutes for approval. Is that correct, Madam Clerk?
Yes, that's correct.
Great. Now the council will sit as the Board of Health. This morning we have Dr. Bridgers, Dr. Kroll, and Dr. Stoddard who are joining us. Dr. Bridgers is going to have to jump off for a short while, but we're hoping may be able to jump back on. I want to announce publicly that our colleagues in Montgomery County Public Schools are not participating in today's Board of Health session, but we knew that in advance. They are meeting as we speak at the same time with the Board of Education to discuss their recommended operating budget for the upcoming fiscal year. That has a firm deadline. And as we all know, they have a very large budget. And so we respect that our colleagues in MCPS are conducting their business, but we do look forward to having them participate on our January 18th session to discuss the myriad of issues that were talked about in a town hall hosted by our colleague, Councilmember Hucker, on Sunday afternoon, which had over 3,000 participants and just further underscored the emotion and the frustrations that are being experienced by many right now for very understandable reasons. So with that, I will turn it over to our Department of Health and Human Services team to give their presentation with an update of the numbers, the situation on the ground. And this morning, we will also be discussing the introduction of the vaccine passport. We have issued a series of questions to the executive branch, and so there will be a discussion regarding that item this morning as well, which we will bring back up again next week when we will hear from some of the key stakeholders who will be the most charged with carrying out that order. So with that, we turn it over to the HHS team.
So good morning. I just wanted to weigh in just a little bit, Council President Albornoz, before Dr. Bridgers and Sean O'Donnell do the COVID report, just to acknowledge that the tragic fire that took place this past weekend over at Long Branch, and to thank Council Member Hucker for his message regarding the support that the work that the team did over the weekend to try to make sure that these 56 individuals and those households were supported and sheltered and got to safety, and the work continues with them to get them in place, to get them taken care of. The team did a phenomenal job, and now is partnering with the community to make sure that those folks that their lives are back on track as quickly as possible. So I very much want to appreciate that and acknowledge the moment and the work that they have done. So thank you for that brief interlude. Now turn it over to Dr. Bridgers for the updates.
Good morning, Council President Albornoz and the council sitting as the Board of Health. Thank you, Dr. Kroll. Just a couple of updates before I turn it over to Mr. O'Donnell for his post report regarding our case data, hospitalization, and some other key metrics that we continue to track on a daily basis. From my conversations with the Maryland Department of Health, there's been a lot of interest regarding the COVID-19 daily report. And so in my discussions with Secretary Schrader and Deputy Secretary Chan over the weekend, those reports will resume this week. I don't know exactly what day, but those reports had a treasure trove of data that we use to compare not only our county level data, but state level metrics, as well as the Centers for Disease Control and Prevention. And so those reports are forthcoming. The Maryland Department of Health Information Technology team has been systematically going through those reports to ensure that any of the challenges that they experience during their cyber attack contact were addressed. And so that will be a great return of data. Speaking of data, we've had conversations with our hospital systems. We're going to resume conversations with them on a weekly basis, looking at hospitalization data more closely, looking at staff to patient ratio, ICU and acute care bed usage, and resuming or increasing support for their staff testing using CDC's current guidance. We will continue to work with them and continue to support them and look at other metrics as we manage the Omicron surge. The Omicron variant has been resulted by the Johns Hopkins University Hospital, and 95.5% of those results were the Omicron variant. We're also monitoring influenza-like illnesses in our emergency department and our urgent care settings. We know that in data that we reviewed over the weekend, identified illnesses with influenza and the coronavirus known as Flurona. And so we made a concerted effort at the beginning of flu season to get our countyans vaccinated. Thank you to those who continue to get their flu vaccines based on the data from my EPI team that I received this morning. Montgomery County's vaccination rate is at 35.9% versus the state of Maryland, which is at 30%. So we continue to lead the state in getting folks vaccinated, and we continue to work with our hospital systems to identify those Flurona type illnesses. The last piece is that we're continue to look at additional symptomatic data and outbreak data from community level spread versus other systems related spread, such as school related outbreaks. I'll stop there and turn it over to Mr. O'Donnell to run through the pulse report and provide metrics regarding our hospitalization rates, case counts, and distribution and vaccination rates.
Thank you, Dr. Bridgers. Just ask someone to confirm that they can see the report. Okay. So going through, we know we've been tracking along with this disease as we go through this wave of increased cases, increased positivity. At this point, we are at a 25% positivity rate for testing that's being done in Montgomery County. We're a little bit lower than the state level, and that positivity rate has come down a little bit over the last few days. We'll see if that is a sustained decrease or not, but it has been essentially around the 25% range for several days now after very steep increases each day. This is a 7-day rate, so it hopefully does not fluctuate as much day to day. Looking at our case rates, we are doing a really massive amount of testing throughout the county. The CDC reports around 80,000 tests have been done across the county over the last 7 days. We are finding lots of cases with high positivity rates and lots of testing. We are now at more than 2,000 cases per 100,000 over the past 7 days in our county, and that transmission rate has continued to climb. Looking at the rate of hospital bed usage, we are at high utilization within the county for COVID patients within our hospitals at 34% utilization. And one thing of note is that not every person who's at the hospital is there primarily for COVID, but they may also have a COVID diagnosis, and that's because our hospitals are doing COVID testing for all inpatients. So we may see a higher percentage here. Recent reports out of the New York City healthcare system is that they are finding as many as 40% of patients who have COVID in the hospitals were not there primarily for COVID. We're looking into this with our own hospitals, but it's worth noting that even if a patient is not at the hospital primarily for COVID, having a highly infectious disease in a hospital setting utilizes a lot more resources when it comes to isolation, and a diagnosis of COVID can complicate lots of other health issues. Looking at the total ICU and acute beds occupied by COVID-19 patients, again, this number has been going up. We're at 509 total patients across all of our acute care settings. And that includes 363 in acute care beds at our primary hospitals, 71 in the ICU across hospitals and the alternate care site, and 75 patients at the alternate care site in Tacoma Park. One of the questions that has come up is how Montgomery County's severe illness compares to other jurisdictions in light of our high vaccination rates. We have been tracking along. As we said, there are people who are at hospitals, not primarily for COVID, so that makes tracking just hospitalizations with COVID diagnoses challenging to say that, because there are still some elective procedures happening in hospitals. It's challenging to say that our hospitalization rate of COVID patients strictly tells a story. However, the death rates we've seen, while increasing notably in December and in the early part of January, we are still a much smaller percentage of COVID-related deaths compared to our representation across the entire population of the state. We'll continue to track these, but as you can see from the data across the state, from November to December, deaths from COVID went from 309 to 549, and already in January, we're at 447 across the state. So it's certainly concerning, and this is data that typically will trail case identification and hospitalization by several weeks. So, this is something we're still tracking on. Looking at our vaccination rates, this is, of course, from the last week's Pulse report. We should have updated information by tomorrow, but our numbers are continuing to go up incrementally. We are at, I believe, 83.5% of the total population now who are fully vaccinated, and our booster levels continue to increase with turnout. We have resumed the data feeds in from the state, giving us a better idea of total vaccinations across all populations. We continue to track on the geographic location of places in our county where we have lower vaccination rates, as well as the vaccine uptake by race and ethnicity. And with the November eligibility for our 5 to 11-year-olds, we've seen these first dose rates begin to climb again, but we've also seen a little bit of disparity happening amongst who is coming out to get vaccines. One thing of note is, I'm going to go back one slide here. In talking about our 5 to 11, we are in the mid to upper 50% range for first doses, and at this point, likely past 40% for second, for fully vaccinated. But the turnout has slowed considerably for those clinics. We've continued to do clinics. We did them over the weekend at MCPS sites. We had handfuls of new individuals in this age range come out for vaccines, but it has slowed quite a bit. And we're strongly encouraging parents who have not yet gotten their children who are 5 to 11 vaccinated to please bring them out, so we can continue to protect our school-age kids and be able to offer school and other safe places with a high vaccinated population. The vaccination rates, particularly within 5 to 11, here we use 5 to 14 as a proxy because of how the data is reported. But we see that it is generally well spread out across the county. We have a couple specific zip codes with lower vaccine rates for that age group. And we have focused doing clinics within those zip codes. We do have daily clinics at within the Germantown location, and we've identified locations to do additional vaccination clinics for kids in the East Olney area. We are starting to make up some ground on the disparities within our ethnic and racial communities that were at lower vaccination rates. Those numbers are starting to climb back towards the population representative sampling. And this is something we've seen with other age groups as we've gone through them. It has taken longer to get some of our populations vaccinated, but they do eventually come out. As has been mentioned, the testing volume has gone up quite a bit across the county. These are numbers specific to our county-run sites. And you can see testing includes, in our totals here, not just the public county sites, but also other places we do testing, including municipal partners, government agencies, and some of our other sites like shelters and congregate living. This doesn't necessarily include all the rapid tests at this time, but we're working on including that as well, because that's making up a significant proportion of testing going forward. Looking at it graphically, I can add on to this time frame to say that from the 3rd through the 9th, we did at just the HHS large sites an additional 9,445 tests. That was about a 35% decrease from the previous week. Some of that has to do with we did need to stand down one site for 2 days because of limited staff because of COVID. We also had, of course, severe weather multiple days, which really impacted the turnout for testing. Additionally, I think we saw a really high rate of testing right around the holidays as people returned from travel. And again, I just wanted to mention that the CDC's reports are that Montgomery County had 80,818 tests performed over the last 7 days, which is a significant increase from previous reports. And as far as rapid testing goes, we continue to work with a number of different manufacturers to obtain rapid tests. We've made a significant amount of headway in this. We do continue to distribute tests out to some of the higher impact populations who have had a higher impact from COVID, as well as those that continue to represent greater risk because of the congregate settings they work in or live in. So we continue to distribute out to those, including adult daycare facilities this past week. Additionally, more than 2,144,000 rapid tests have been ordered from vendors. A total of 588,000 have already been received. Of that, 190,000 have been provided to MCPS as part of their testing their populations with return to school. And as of yesterday, our first day distributing through our library partners, over 93,000 rapid tests were distributed. And this was a phenomenal success of our librarians who volunteered to work at these test distribution sites, as well as our Medical Reserve Corps partners who worked with them. And of course, our county agencies who provide a tremendous amount of support behind the scenes, including our Department of General Services, who made sure that all these sites were supplied throughout the day. So that I believe Dr. Starter may have some additional comments on this. We'll continue distributing rapid tests through our at-risk communities, and we have stood up an online portal for the public to report their rapid tests, whether they come from us or somebody else. That is now part of our testing website. You can go on and report your tests through that. I would just caution the public that at the incredibly high number of positives that are being identified throughout the day, we are prioritizing the individuals that we can reach out to and make contact with for contact tracing. It's clearly not going to be every person who has a positive, but we are likely focusing on those who are in congregate settings or high risk to other people who are around them. So we'll have more information on that going forward. But again, we're identifying lots of people in the community who are positive, which is good. And at this point, most of the folks in our community know what a positive diagnosis of COVID means. It means you should isolate for the period of time until you recover and are no longer infectious. That's the update from public health right now, and happy to turn it over to Dr. Stoddard if he has additional information he'd like to add.
Thank you, Mr. O'Donnell. I appreciate it. A few things I want to comment on. A couple things that Sean already alluded to. So first, for the rapid kit distribution, well, let's start with the reporting portal. So we are going to have the portal is actually being translated into Spanish at today. So we'll put out a press release describing the portal, both English and Spanish, going out hopefully later today once the Spanish translation for the portal is complete. But obviously it is up and running in English and the back end works and all that stuff. And we wanted to make sure that was the case. But obviously we'll have it translated and put out information to the public about utilizing that portal. As far as the rapid kit distribution at the libraries go, it was a phenomenal success. I want to join Mr. O'Donnell in thanking all the partners who were involved in it, particularly the libraries and library staff, as well as the volunteers who did the distribution. I know several of you on the council did participate yesterday, and we appreciate that as well. That said, obviously 93,000 is a big number. It's a great number. We're very happy with the distribution, but we don't have a supply to sustain 93,000 rapid kits a day for the 6 days a week that we'll be doing that distribution, considering the other partners that we do have to support. So beginning today, we will be limiting each site to between 1,800 and 2,500 kits per site. That will be about 35,000 kits across the county per day compared to the nearly 94,000 that we did yesterday. But that will allow us to sustain the effort through the rest of the week, including Saturday. We are hopeful that we'll get another delivery later in the week, and we may be able to up those totals as we do, but I want to make sure that we can commit to keeping the site open for these shifts and days that we've already advertised and made public. In addition, we will be providing additional kits to the public school system, our private school partners, childcare providers, and a number of the community partners that Mr. O'Donnell already alluded to, as well as we've opened up a process for our municipal partners to request specific allocations, and we are working with them. We know, for example, with the Poolesville Library currently closed, we need to have the site up in Poolesville, and we're working on that actively. So I wanted to make sure that was clear. One other thing that Mr. O'Donnell alluded to, and I think that is important in the data, is about the booster shot. So one thing that was clear in that data, I think we talked about, we were around 50% or 45 to 50% last week, and now we're between 40 and 45. There is an increase in the number of people coming in for boosters, but that's being in some cases outpaced by the number of people who are becoming eligible for boosters. And so obviously with the addition of the 12 plus population being eligible for boosters, there's now a greater population who is eligible. And it's, the people coming in is being currently outpaced by the increase in eligibility. And so we have a large population of people in Montgomery County who need to be boosted. And I do think that is significantly contributing to the hospitalization rate we are seeing in the county and generally to the infection rate. While boosters are not necessarily a full protection against infection, they will reduce your opportunities. And the hospitalization data is stark. 2 doses of the mRNA vaccines, Moderna and Pfizer, or 1 dose of the Johnson & Johnson are insufficient to prevent, hospitalization, at least in patients. There are many cases of hospitalized, not necessarily as severely. I think that's key. It's degrees of protection. So being quote unquote 2-dose or fully vaccinated, which that definition certainly CDC is currently in the process of changing, I suspect. Having 2 doses is a level of protection. It is likely not a sufficient level of protection for Omicron and what we're seeing right now, particularly if you're more than 6 months since your last vaccination. So The last thing I wanted to comment on was we talked a few weeks ago about the impacts of the fire service of staffing. This is generally shared amongst several of the other agencies across county governments, and that's transportation, police, corrections. A number of county agencies are experiencing issues. I will say that we are starting to see, at least in the fire service, that data shift. And I will share my screen briefly to show you the staffing availability data from fire rescue that was shared with me this morning from Chief Goldstein. And I think you can see my screen now. This is sort of shows you over time, day by day, staffing and availability that peaked on January 3rd with more than 160, nearly 170 personnel out from the fire service. And as of today, you can see that downward trend. We're down to just over 80 as of today who are out. So while this isn't a perfect situation, obviously there's just still 80 people who are unavailable to us. It is obviously substantially better than we were at even a little over a week ago. So that shows that maybe we're seeing I think we saw the alignment of the holiday period and the Omicron surge, and maybe we're seeing obviously the holidays are over. We're coming out of that. Omicron's still here and still will be with us for a while, but maybe in terms of staffing and availability, we may not see as bad as we did during the period of the holidays. And so that's all I wanted to show. So I think with that, I am finished with my comments. I don't know if there are additional comments from anyone else on the team, but I think we could take questions.
Great. Well, thank you all for the presentation. I do want to publicly acknowledge and thank the team for all of your efforts to initiate the rapid test distribution yesterday. I personally was not able to make it out because I wasn't feeling great, but it sounds like by all accounts it was a significant success, and I've heard from my colleagues that were there that they received very positive feedback from constituents. So thank you so much to everybody that made that possible. We have a number of my colleagues who'd like to speak, and once again I remind everyone after the Q&A regarding the presentation we just received, we will then formally introduce the public health order at the request of the county executive, and I ask that my colleagues in the executive branch stay on for a conversation regarding that introduction to get some background and context, and we'll go from there. So on the speakers list, I've got Councilmember Rice first, followed by Councilmember Reamer, then Councilmember Hucker, and then Council Vice President Klass. So Councilmember Rice.
Well, thank you very much, Mr. President. It's going to be hard. So my work family knows that my mother unfortunately suffered a heart attack and was hospitalized on Saturday. And fortunately, because of the great care of our hospital system, she's doing well now. She's stable. But it was incredibly scary. And I want to share with folks why vaccinations are so important. Because the hospital that she was first sent to, Holy Cross in Germantown, was overwhelmed. And as I talked with the hospital staff there were so many things that they were trying to do to handle the critically ill, like my mother, in addition to those unvaccinated, majority, who had COVID. And I talked to many of the doctors and nurses throughout the day as I sat there in a waiting room. And I also talked to family members of people who were unvaccinated. And the same stress and fear and worry that I had for my mom was the same exact thing that they were experiencing. So I have a personal plea to all those who are unvaccinated who think that, I can handle this on my own. The reality is that think about someone else besides just yourself. Think about your family and friends and how they're going to sit there in that waiting room and hope and pray that you make it, that you live. Because that's what I was doing for my mother. And I was also concerned about the fact of how they were both competing for the same space. And so there's so many critically ill patients that will go into our hospitals who will need that space also. And so we don't want to take up those spaces with people who can actually prevent being in the hospital in the first place. So I beg of you, please, if you're not doing it for yourself, do understand that there are other people out there who are going to have issues that are going to need to use that hospital space. If you can't do it for yourself, do it for them. And if you can't do it for them, do it for your family and friends who are also going to be sitting there in the waiting room, praying in prayer circles, talking about the memories that they have of you, hoping that they'll still have additional memories of you, that they'll be able to live with you and make. Because I talked with those families. As I sat in the hospital for 2 days, we all start to talk to each other about what's going on. And I talked to families of those who had done everything they possibly could to try and encourage their family members to get vaccinated. And they refused. And now here they are fighting for their lives. And if you don't do it for them, then please do it for our hospital workers, our doctors and nurses. Because as I found out about my mother and was in the hospital with her, I found out that my mother-in-law, who is a nurse at Holy Cross Silver Spring, contracted COVID and had COVID and pneumonia, who was also vaccinated and boosted. So even though she was vaccinated and boosted, she still got COVID and had it seriously enough so that she actually developed pneumonia. And fortunately, she is also now stable. However, I say to you, our healthcare workers on the front line are fighting each and every day to protect and care for those of you that are sick. And they're putting themselves and their lives on the line. I've talked about this before, about how my mother-in-law, along with all of our healthcare workers, has always been on the front lines, caring for those as we set up the tents when we first found out about COVID and had the tent set up outside. She was out there testing people, trying to make sure that people were safe. She was caring for people who she didn't know, because that's what she said that she was going to do. And so many doctors and other nursing professionals and staff that are in these hospitals are doing the same exact thing. So I ask you, if not for you, do it for the people that would be sacrificing themselves for you. It's not too much to ask. It's not. And so I really want to just say thank you to all of the professionals that cared for my mother and my mother-in-law. It was an incredibly traumatic weekend for me, but one that was eye-opening as to exactly why we need to make sure that we continue to press for vaccinations. The unvaccinated are 9 times more likely to enter our hospital system, and those beds and those resources are precious. Keep in mind, it's not just about the beds. The time that they spend, the nurses told me, the time that they spend with a patient that's unvaccinated and the procedures that they have to go through because they know that now this person is COVID positive requires more time and more effort to try and ensure that they themselves don't get sick. And those precious time and resources are ones that are then diverted from other patients who also need that attention. This is real. I've seen it at 2 hospitals, at Holy Cross in Germantown and at Washington Adventist. And all of the stories are the same. We can change this by making sure that we continue to push for vaccinations for everyone. Set aside your political debates. Let's do this for us as people, as a society. Thank you, Mr. President.
Councilmember Rice, I know I'm joined by all of my colleagues in expressing our deep appreciation of you and your family. We're so happy that things are turning out for the better. And that message was so important and so authentic and something we all need to be hearing right now. So thank you so much, Councilmember Rice, for your leadership and for the blessing of your family as well. So colleagues, I wanted, Councilmember Rice signed up to go first, but I was going to give him a longer runway anyways to share that personal story, which is so important, especially that since it occurred this weekend. I do ask the rest of my colleagues to limit your comments to 5 minutes. If you want to get back in the queue in the end, that's okay. But we still have to get to the vaccine passport discussion, and we have the rest of general business and a lot of other stuff to get to this morning. So with that, I now turn it over to Councilmember Reamer.
Thank you. Councilmember Rice, thank you for your powerful comments. You know, my mother had a heart condition earlier in the pandemic, and we were just so fortunate that she was able to get access to care. It was not during one of the peak surges, and had it been, she had a condition where she needed rapid treatment, a surgery, and that's the real cost that the unvaccinated are bringing is, overwhelming health systems. And then folks who get into a car crash or have a health condition that needs treatment are finding it harder. And our hospital system is not just filled with Montgomery County residents. We're experiencing the overrun of unvaccinated Marylanders who are from other counties who are being placed in our hospital system. So even though we are so diligent here about following the best practices and getting vaccinated and increasingly getting boosted, there is still a consequence to us from those everywhere who are refusing. And I think Councilmember Rice's appeal to do it for others hopefully is heard. I thought that today's New York Times, David Leonhardt, shared some very powerful information about the divergence between the vaccinated and the unvaccinated in terms of their hospitalization rates and their death rates in two cities that have provided reasonably good data, New York and Seattle. And it's just so striking, the massive gap between the health outcomes of individuals who've been vaccinated and those who've not. And that's really continues to be the urgent priority. And my concern at this point is I think we've lost our footing with the medical guidance. And I think that we're having conversations without the benefit of expert voices from organizations like the American Academy of Pediatrics and the children's hospitals. And we're simply listening to one another as residents or even as elected officials, at large in the community. And we have got to return this conversation to the health and scientific guidance of those who have access to the data and who understand, the health science. So I think there's far more reassuring information for our community about the risk level that you face once you're vaccinated. Should be assuring and calming. And I think we're having trouble getting through with that in the midst of this COVID hurricane, which is just blowing outside. And so I do want to ask, along those lines, I am a big fan of Dr. Bridgers. You're doing a great job. But I wanted to find out, where are we on hiring a new chief medical officer, understanding, Dr. Bridgers, just for certain reasons, is not eligible to be that person. And I think we need more expertise and capacity at the table. We need more knowledgeable guidance and health and scientific leaders sitting there to help guide our schools, to help guide our county. So we have been months now without a replacement for Dr. Gales. And where are we in the process of hiring a new chief health officer, chief medical officer?
Councilmember Raymer, good morning. Thank you for the question and for your comments. And just want to also say thank you, Councilmember Rice, for your candor and your sharing your story and the experience of those folks who are in the waiting rooms with you seeking help in this moment. We are, in fact, we are interviewing for health officer, candidates for health officer position this week. We did a first round before the holidays, and the candidate that we thought was going to be the candidate we might have put forward made a decision. One of the candidates made a decision to decline and go and do something different with their lives at this point. So we are still in the search for a candidate. Obviously, we're wanting to find as quickly as we can the best candidate that we can for the job, and the most qualified candidate that meets the needs of Montgomery County. I do want to assure the public that we have an acting health officer, Dr. Bridgers, who has the expertise and the experience to continue to do this work, but he does not do it alone. We continue to have consultation from the health officer from Prince George's County where we need it, and a panel, an advisory panel that Dr. Gail's put in place that is still active in supporting the effort. So it is not a one-person operation. It continues to be an entire team of folks that are making good decisions and offering good guidance and good advice to Dr. Bridgers and to the public health team in responding to this pandemic.
Thank you. And I truly mean, my comment is not in any way an aspersion on Dr. Bridgers, who I think is marvelous. It's just that, we need a chief health officer at the table. And I am concerned about the guidance that has been provided. I think one of the chaotic elements of the January school process has been the guidance provided to MCPS and their response to that guidance. And I think having a a chief health officer at the table would help smooth this out, provide more certain and I think stronger guidance to help us through. So please keep us posted. It's obviously urgent that we hire this position and try to recenter this conversation in health and data and science. Thank you so much.
Thank you, Councilmember Reamer. Next, we've got Councilmember Hucker, followed by Council Vice President Glass. Then we will hear from Councilmember Friedson, Councilmember Katz, followed by Councilmember Navarro. Councilmember Hucker.
Thank you so much. Thank you so much, Council President, and all of you for being here. I want to acknowledge and thank you again to Councilmember Rice for sharing that really important experience that we all wish you weren't going through. I want to thank Dr. Kroll for his mention of the fire at Long Branch too, and the call from Dr. Stoddard that I got that morning, and all the great work of HHS and OEMHS that I saw firsthand this weekend. Patrick Campbell and Marianne Soders did a great job taking care of those residents. I'm glad they were put in a hotel. I hope we can continue to look for one in Silver Spring, closer to their work and their families. I have some options for you, but they were definitely, the team performed very well Saturday morning. And thanks to the council president and several colleagues for attending the community meeting we put together on Sunday. Yeah, it's unbelievable. We had, in fact, it turns out over 5,000 attendees on 24 hours notice, and many more who watched the video. So there's an unbelievable amount of concern and anxiety out there about the pandemic and its effect on our schools and our students and our staff that I just haven't seen before. One thing that came up is our questions about decision making. Can you tell me how often HHS meets with the Board of Education to discuss COVID safety guidelines in our schools, and whether those meetings are with the whole board or the leadership of the board?
So, Councilmember Hooker, I can't tell you exactly how often we meet with the board. We do meet with the board periodically to share with them our guidance and our thinking about the pandemic, and to give them whatever counsel they are asking for. We are meeting with the administration of the MCPS on a regular basis to make decisions and to try to figure out what the process is going to be for how we keep our students as safe as possible and align with the decision to keep schools open.
Thanks. Could you tell us a little more about what periodically means? I did talk to several board members who feel like they'd say sort of in the dark at times, and I'm sure they're grateful for your meetings with the superintendent and the leadership, staff leadership, but the public certainly, I think, has an expectation that the board members are making decisions as well and consulted. So it is periodically, like once every few months or once every week? How does that work?
I can't tell you the last time we met with them. I believe it was a week or so ago.
Okay.
So it is when they are convening and wanting to discuss this with us and asking us to be there. If we're here, we're not there, obviously. So we might have been invited to this morning's meeting, but not been able to make it. But we are meeting daily with the administration and conveying messages to them, and have confidence that they are sharing our guidance and recommendations to the board.
I see. Okay.
But we've never been invited to a meeting that we did not attend. So I think that's clear. So any meeting they want us to come to, we'll have HHS representatives all in that meeting with the Board of Education.
All right. Well, that's definitely clear. Thank you. Which I'm sure I'm probably not the only one of us who'd like to sort of catch up on that process. So if you wouldn't mind sharing like the minutes from those meetings, I'm sure you're documenting it also. Just be nice to know sort of how decisions have been made, so we can answer the questions from, we're drowning in questions from constituents on this. Could you
I don't know that we document the minutes of a meeting for the board necessarily, of the school, of our meeting with the Board of Health.
No, you probably wouldn't the board? So I should ask the
Board of Education made documents, so you'd have to ask the Board of Education for those.
Okay, I can ask them. Thank you. Could you explain just more about how the decision tree that you use with the MCPS about how safety decisions are made?
So happy to talk about that. We are looking continuously, and this, I know that there's been a lot of controversy and a lot of discussion about the last several weeks, but we're constantly looking at what we're seeing in terms of school positivity rates, the rates at which we're seeing infection, the numbers of students that need to be contact traced, et cetera, from our side of the table. We're also looking at what's happening with the staff and whether or not they're being infected and whether or not there is that poses hazards and threats to the school. So and we're also looking now at adding an additional set of we're also, I've been looking at, but adding to that discussion a look at what's happening in the county, in the regions, as in relation to what's happening in the schools in terms of rates.
Okay, thanks. So a speed round because I'm running out of time. Can you begin testing on site at schools now that we have enough test kits for staff and students who request it?
So yes, the plan now is in the face of Omicron, and it is to bring rapid testing. Dr. Stoddard mentioned that we distributed 190,000 tests to the school system. The plan now is to send those tests. The school is now sending those tests out and asking folks to respond back with the results of that. So we get a clearer and sharper sense. We're continuing to test in the schools for symptomatic students and identifying positives and close contacts. So we're in that flow.
I strongly think we should, as quickly as possible, move to requiring a negative test to attend school, like DC and Baltimore are doing. And how soon will you? I'm glad that Google Form is being translated into Spanish. How soon will you translate it into the other languages that our families use?
So I'll have to check back with the team on how quickly they can get those translations up, absolutely as fast as we can, obviously. You should know that the school has a portal that they have been reported, that people have been reporting. Right. We will use their portal, and we'll have some conversations with Mr. O'Donnell about how we link those two portals together to eliminate confusion.
Right. I understand that that's still just in those two languages, so that's probably why a lot of our schools that are the highest poverty and have the most language diversity are reporting the fewest cases, which is probably not accurate. But
it's one of the reasons we went to 190,000 tests to distribute tests across the entire system, is try to get a sense from everyone what sure. But
if they can't report on the form, then you are not going to get the data we need, right? I mean, I know you know that. Thank you so much.
Sure.
Thank you, Council President.
Thank you, Councilmember Hucker. Council Vice President Glass.
Thank you, Mr. President, and good morning, everybody. I first want to applaud libraries and DHHS and all of county government for the very orderly distribution of the tests yesterday. I stopped by the Wheaton Library and Rec Center and saw the line wrap around the building. And then when I went inside to help distribute tests, it was working smoothly, efficiently. And I also want to applaud our residents for being courteous, not only to each other, but to county staff. The line again and the people, it was a pleasant experience from my perspective. And I know the volunteers and the staff that were there also did not exhibit any problems, at least at the Wheaton Library. I know that from what I've seen on social media and text, there were some problems with people finding parking or some traffic situations at various locations. And I would strongly urge people to maybe park a block or two away if they're able to do so, understanding that not everybody has the ability to walk and then stand outside. But if you're able-bodied, walk a block or two and spare yourself some of the parking headache that might exist in some of those locations. But again, my hat's off to everybody who is helping to do this. I've also received some correspondence from residents in the western part of the county, particularly Poolesville, whose library is undergoing renovation, and they are wondering if there's going to be special accommodation for them to be able to receive some testing.
Short answer is yes. We flagged Poolesville as an area of need. We've been working with the commissioners from Poolesville to identify an appropriate location and mechanism. So yes, Poolesville, we're going to have additional locations. Actually, we're going to have some additional things to announce over the coming days, but Poolesville will be among those places we identified, yes.
Excellent. Stay tuned, Poolsville. And then also, I know that there was a slide I think Dr. Bridgers had shown during the presentation about all the different agencies and social service agencies and others that are going to be able to receive some of the tests of the more than 2 million that the county has at least ordered. I'm curious about the partnership or collaboration with some of the social service agencies, and I've also gotten inquiries from some independent schools about where they might be in this queue.
So we've got certainly, so the community groups we're dealing with on an individual basis. So we've been doing, actually, the community groups have been getting kits for longer than most. So if they're interested, they can certainly reach out to us and we'll add them to the group of people that we're providing kits to. Obviously, we're getting a large number of kits. They're not all here yet. So we're trying to figure out how in the actual, what we have on the ground now, we can distribute that best, recognizing that there's 1.5 million more or so coming. So we're going to have a lot more to deal with. So we're going to provide community groups. If they want to reach out to us, we can certainly add them to the group of people. We'll figure out what the best distribution is, make sure we're spreading across the county as best we can. Now, on the independent schools, we've already received 20 or so schools have reached out directly. And so we are going to start providing those as well, just as we are for MCPS. Just again, the requests outpace the current supply. And so we're trying to balance what we give out to the libraries. We're making sure that all these other mechanisms are being met so that we can get as broadly available within the community as possible. So if the independent schools want to reach out as well, happy to receive those. I'm going to tell you right now, not all orders will be met week one. That just will not happen. But, we are certainly going to spread this out. And the private schools are a group that we've already flagged. Mr. O'Donnell and I met yesterday to discuss this. They are already a group that's going to have a portion allotted to them, and then we'll divvy up from there.
Excellent. Welcome news. And I will encourage folks to contact you if they want to get into that queue. Just switching gears, I also want to extend my own sympathy to Councilmember Rice for what he and his family are going through right now. And last week, the governor said that he was, employing, National Guard to help with the crisis that is in our hospitals. And I am curious to know, what the state of our own healthcare facilities are here, aside from the anecdotal stories that we're hearing. Do we know if any of the National Guard are going to be deployed to any of our healthcare systems? And then, quite frankly, number of folks I've been speaking with are curious whether or not the National Guard can be used for other needs, whether it's school bus drivers, whether it is ride-on drivers, understanding commercial driver's license issues there, but just trying to see what flexibility and what the need might be with the National Guard.
So we did file a request for the National Guard to support Montgomery County Public Schools transportation. That request is still pending. They're still looking around. My understanding is the National Guard may not be able to help, but they've also sent it around to counties around who, may be able to help us with additional. We've looked also through our emergency management group internally at county employees and partner agencies who may have them. So I don't have anything to report on that front in terms of needs being met, but we've made the request formally for the Guard and gone through the process with the state of Maryland to do that. So that was something that MCPS requested of us, and we sent it up. So we are trying to help them to the maximum extent that we can. But obviously, CDL drivers were a problem before. CDL drivers with a background check so that they can, supervise students while they're on the bus. Also a challenge, but we are actively working on that problem with them.
Very good. Making the request is the first step in the process.
Yes, right.
And we can always appeal to the governor, as we have over the last 2 years, to get things that residents of Montgomery County need. And so I appreciate the initiative there. I see my time is up, and I will yield back to the president. Thank you very much.
Thank you, Council Vice President Glass. We've got Councilmember Friedson, followed by Councilmember Katz, then Councilmember Navarro, and then Councilmember Jawando. Councilmember Friedson.
Thank you, Council President. Thank you to the health team. I just first 93,645 rapid tests is a staggering number. And so I just wanted to thank the health team, the libraries team, and everybody else who was involved in that effort. It's not an easy undertaking, obviously, and certainly there's a lot more work to be done, but thank you for that. you see the need and you see the tremendous anxiety that is in the community. And so meeting that need is going to continue to be a challenge, but I appreciate that yesterday was a really important first step to that. We also see that our residents step up and do the right thing when they're asked to. And that has been the case throughout this pandemic. It was the case yesterday. We said we have available tests. We want you to show up and get those tests and use them when and as they're needed. And we want you to be courteous and respectful as you do it. And overwhelmingly, residents stepped up to do that yesterday. And I know and trust that they will continue to step up to do that as we move forward. Appreciate the specific work on the Poolsville site. That is a big need in Western Montgomery County that in so many other ways lacks adequate access to health and public services. And so appreciate the work there. And also in Friendship Heights that has a disproportionate elderly population that are at particular risk during Omicron. Just wanted to get a sense, I know you're working on it, but if there was any idea of potential timing for when those could potentially be online for residents to actually benefit from them, and then what the communication would be. Are the municipalities going to be communicating? Is the county going to be communicating? Will it be a combination to do the outreach?
It will be a combination, and I know I received, for example, I received the formal request from Mr. Mansfield on exactly how they were going to do it through Friendship Heights this morning, and I believe that Mr. Eck from Poolsville Commissioner had reached out with their distribution plan this morning. So we'll review those this morning. I think that they both propose Friday start dates, but I'll let they'll be part of the announcement. We'll support their announcement with that, but obviously we will work through getting them the kits that they need to allow that to happen. So it looks like both Poolsville and Friendship Heights have requested to start on Friday. We'll get them a number of kits to do that with. And then we'll let them start to push that announcement out. But what we've said is, and I think we'll make this clear, while the municipalities they're going to help us support this, and that's great. They'll be able to offer particular nuanced opportunities for their participants, and they're allowed to message in whatever way they think is appropriate. We also don't want to see people turned away who are county residents at sites that are administered by the county. So we're trying to balance those things out, giving maybe a opportunity for them to message more specifically to Poolsville, for example, so that you don't have that site being overrun in the way that other sites have been overrun from across the county. So we want to make sure they have a special opportunity, given that they have been, as you said, fair access has been an issue in Poolsville. Certainly one that the county executive has recognized, and I know you've been very supportive of as well. So,
well, appreciate your sensitivity to that and your work. If you could share with us once those plans are formalized, and we'd love to help be part of the outreach effort. Certainly the municipal partners are critical here, but there are a lot of other stakeholders that are involved as well, and we could certainly be helpful with that. So please keep us apprised of that. I also appreciate your work now with the independent schools and the child care. Obviously that's something that has come up repeatedly, a major need. And I know the request may not be able to be fulfilled immediately, but any sense of timing and the amount of tests that you would expect for those two areas or organizations?
Yeah, so what's been requested is 80,000 test kits for the child care providers, which is roughly basically a 2 test kits for every provider and child in that we have with the registered child. And that's not all informal, but that was sort of the rough request. Now, my guess is that's going to take multiple weeks of giving it, 25, 30,000 a week, something along those lines. And I will also say for the child care providers, we are also going to be providing them with KN95s to upgrade the face masks that are available to them for child care settings as well. And so that will be done as a combined effort. Miss Netta Squires from Emergency Management is coordinating with Health and Human Services staff to design a program, just as we had done previously with PPE for child care providers, a similar program to begin distribution. Their intention is to begin distributing this week, but obviously it'll be a multi-week process to get all the child care providers in. Now for the private schools, obviously the requests are still coming in, so we're trying to field them in real time. I think we've allocated approximately 20,000 from our current supply for that. To begin that process, and that will be an ongoing process. That's not 20,000 for the entire time. but it's 20,000 from what we know we have on hand. We have more shipments coming, but that's sort of the rough strategy for private schools right now.
Appreciate it. You said earlier, Dr. Stoddard, that the vaccination that we consider to be full, or at least previously considered to be full vaccination, perhaps officially considered to be full vaccination as a terminology, 2 doses of the 2-dose, what were considered previously to be 2-dose vaccines, which I actually believe are 3-dose vaccines at this stage of the pandemic, provides a level of protection, but not a sufficient level of protection, which I think is a good way to describe it. What are we doing to get that word out? Obviously, we can only do so much at the county level, but this is really a 3-dose vaccine. The numbers are overwhelming that you've shared earlier today and that we've seen elsewhere throughout the country, not unique to Montgomery County, that the level of protection that you get for Omicron in particular from 3 doses, it's not really a booster, it's really the 3rd dose, the 3rd necessary dose to have a sufficient level of protection, as you stated. What are we doing? What's our plan with that? Because I do think that that's the most important thing that we can do for our residents, and frankly, as well as we have done to get our residents 83% and climbing, fully, 2 doses and 95% with 1 dose. We're slightly better, but not nearly as good as we would want to be at 40, around 40%, receiving the 3rd dose. What are we doing to significantly and dramatically boost those numbers?
Yeah, so the Office of Public Information has been working with HHS actually to launch a similar campaign to what we did during the early days of vaccinations around boosters, meaning a specific campaign driven around booster uptake that focuses not just on English-speaking populations using media and social media, but also, using those nuanced things that we had great experience with in our diverse communities across the county. And so obviously things like the Salute effort, as well as the AAHP, AAHI initiatives will be utilized to do the same things to really try and press upon people the need and importance of boosters. But there's been a specific talk about programming and resources in terms of financial resources put towards a specific effort around encouraging boosters. Now, obviously, I think there are other things that we should talk about. And obviously, we'll be talking about the notion of the passport program later and whether we should potentially include boosters in that program if such a program we considered. There are other things that we can do and other levers that we can utilize to look at that. But certainly, I think what has become increasingly clear over the last certainly 3 weeks, you can have your anecdote, you can have your data, and they both line up to say there are still people who have received 2 doses of the vaccine who are being hospitalized. That is beyond question. About 25, 30%, depending on where you look, of hospitalized patients have the 2 doses. Very, very, very few hospitalized patients who received the booster. There are some, like 2%, I think, in the University of Maryland medical system have received boosters, but compare that to 25, 30% who have 2 doses, and then the remainder are unvaccinated. And so it is clear that getting 2 doses is a great step in the right direction. It is very clear it is not sufficient to prevent hospitalization in a broader swath of people. Now, it may protect against death. I think that's an important thing, and we should recognize that and appreciate that for what it is. But for when we talk about hospital surge, that booster shot is key, and that's the messaging that we're going to be putting out. And we should all be thinking about how we can do additional steps collectively to encourage and or push people in the right direction.
So I would
I see my time is. I'm sorry.
Just to add a piece of that one of the things that has happened last year and is happening now is that when we have these surges, people turn their attention immediately to testing, and all of our voices start talking about testing and getting resources out. It is vital that we collectively message test and vax, and to get vaccinated, because otherwise testing doesn't keep us from getting the dose, getting the virus. It tells us where the virus is and who's contracting it. But if all people are focused on is testing, and all we're focused on is messaging on testing, then they'll go for testing and not go for vaccination. We need to continue to drive forward the message around vaccination to people. We're also looking at doing more integrative testing and vaccination opportunities, so folks can get tested and get vaccinated, and or get first, second, and booster shots all in one form. So as we've gotten past our first effort with pediatrics vaccinations, we're now expanding out to make sure that we've got combined vaccination efforts in play. So,
Dr. Kroll, thank you so much. That is specifically what I was getting at. I appreciate the fact that you and Dr. Stoddard and Dr. Bridges are working on it. I see my time is up, and please keep us informed on that and let us know how we can be partners to get that word out, because I do think that this is a communication and an operational effort, and it needs to go hand in glove, and we can be partners on that. So thank you very much.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. Let me just start by saying to my good friend and colleague, Councilmember Rice, I sincerely appreciate, first of all, it was upsetting to hear what your family is going through, and then it went through it a second time. But you know that you're very important to all of us on this council, and especially your own personal family. Your mother especially is I think everybody's mother who has ever met her. So we are all continuing to pray with you. And I want to thank everyone for all the work that's being done on this. This is obviously an unbelievable task that you're doing. And I guess it's to Dr. Stoddard. Are we going to continue to give 2 tests per person who for the rapid test? How is that going to work?
Yeah, that's our intention to still do that, because many people are coming in to pick up on not just behalf of themselves, but their family, or alternatively on behalf of someone who's sick that we don't want coming to the site themselves. And so that's been our mechanism. We're paralleling what the District of Columbia has done. We think there being regional similarities is an important benefit to the people. There's no confusion about when 1, 2, or whatever.
And then I've had the question, when someone picks up 2 tests, are they allowed to come back the next day and pick up another 2 tests?
They're allowed to. We would clearly, if we're talking about, I think people referred, I think Councilmember Glass, or Council Vice President Glass, said earlier that we asked our residents to do something. They stepped up. They were very courteous. We're asking that again. If you need the tests, come get the tests. If you're looking to hoard them in your house, please allow other residents to access the kits as well. And so that's our very clear message. If you need to be tested, you have more family members than you could pick up yesterday, come back out. Of course, no problem. If you're doing it so that you can have a stockpile of 5, 6, 7, 8 kits in your house, please let others get it. We're going to keep getting supplies. You're going to keep distributing. You can come back at a later time when you need the test kits. Don't hoard them.
So I would underscore, yes, we're going to continue. This is not the only round of tests. There will be additional tests available for folks, but also to say to folks to let people know that if you need the test now because you think you've been exposed and you think there's some risk of COVID, you may be symptomatic, that's a point to use the test. If you're not symptomatic and you've maintained some social distance and you've kept yourself safe and secure, you don't necessarily need to get back in line for that right away, and you can wait and let some other folks who might have a more urgent need to access the test first and then come back at a later point.
Thank you. And we do need to be clear. And on that, and I want to publicly thank Councilmember Hucker for the event that he had on Sunday and the unbelievable turnout. But I think if we had to underline what was being said time and time again, it's communication. And that is the key. And not that we necessarily know all the answers, but we should give the answers that we do know and say what we're working on and how they're going to progress, not just for the county, but for our partners from the Montgomery County Public Schools. And in that vein, I do believe we need to be clearer on how we're communicating. I had several people call and talk about the booster for their child and say, the CDC says it's available. Well, the CDC didn't actually say it was available. It was that it's available, but then the next group has to look at it, and then an advisory group had to approve that, and then they finally. So I think we need to be very clear on the first page of our website, of the county website, to say this is where the process is. I know you heard this on one of the news channels, but this is where the process is. It's not available yet, or it is available, and how to go through it. We need to keep the message as simple as possible. And I know I'm coming near my few minutes, But I did want to mention that I do think we should not forget about our partners at Leisure World and Asbury and the villages of Rockville. If we could have a place where they could very conveniently pick up the rapid test so that they could get them easier, I think that would be something that we should put on our wish list as quickly as we can. And with that, Mr. President, I'm going to turn it back over because I know I'm at 5 minutes. Thank you very much.
Thank you, Councilmember Katz. Next, we have Councilmember Navarro, followed by Councilmember Jawanda.
Thank you, Mr. President. And I join my colleagues in expressing my concerns and all the prayers to Councilmember Rice's family. We know that they're strong women, so we will keep praying for healing. I wanted to bring up, I guess, a different angle, and I appreciate all of the conversation and the questions, et cetera, as well as all the efforts. I mean, this has been extraordinary. Here we were about a week ago talking about the lack of available tests, and luckily, things were able to open up and things are starting to be distributed. I think it's important. So I want to keep on this question or this notion of messaging and obviously recognizing that this is a very different wave and recognizing that one of the interesting elements of this particular wave is the issue of how it has affected staffing and therefore how that affects services, not just within our county government, but as we also have, of course, been tracking and listening to parents and concerned folks in the school system, the issue of the expectations, because if students are going to be in school and there are so many staff that have been affected by the virus, we know the instruction is not going to be the same. And level setting that expectation, I think, has been, in my opinion, something that it's new, right? We've been so focused on the messaging around being vaccinated and testing, et cetera. But this particular wave, in my opinion, of course, has been so different. Can you talk a little bit about how you're doing that? I know that you've done some work around, for example, the shortages with firefighters, et cetera, but, in your conversations, in your meetings, in your strategy setting, how is that being factored in, and how can we all work together to be sure to set the stage for our residents to understand that, yes, there is absolutely an impact here that is different than other times, and we all are going to have to be patient and recognize that it is real. And then also the piece around how long do you think that these staff shortages, of course, will probably last in terms of tying that to the duration of this wave?
So, Councilmember Navarro, I'll start, and I'm sure Dr. Kroll and Dr. Stoddard and Mr. O'Donnell will weigh in. So we've taken all those considerations that you eloquently articulated this morning. We're looking at those conventional, those crises management, those contingency operations using the CDC guidance. We know that there's no clear-cut guidance right now. That's absolute. We are taking every case, every situation independently to look at not only our workforce needs and challenges, but those school-related challenges as well. As we continuously have conversations with our medical experts, our public health team. We look at the guidance. We know that there have been some questions about the CDC guidance and the need to return folks to the workplace if they've tested positive. We also looked at the American Medical Association and their concerns, which indicated that 30% of those positive individuals and or cases may still be symptomatic and returning to work. And so we're taking all of those metrics into place. We're working with our hospital systems to look at those real-time needs based on their infectious disease units and their occupational care units. So we're looking at all of these metrics, working with our community partners. We know that testing is paramount now. We need to identify those who are infectious. This Omicron surge the variant is highly transmissible. And we're taking all of those factors into consideration at a community level and at an individual level as well. And we're having those conversations. We know that there is no one best fit scenario that can be a universal fit. So we're taking all of those into consideration, and we're making those practical assessments. We're also doing modeling to make sure that we look at those national trends, those state trends, and those county trends so that we can get a better estimate on where we see those surge, where it will peak, where it will not, whether it will be a instant decline, a gradual decline based on our vaccination rates. We know I came into the conversation, I think, at the end when Dr. Kroll indicated that, we're looking at multiple factors and we're looking at testing and vaccination. And we know that those are key preventative measures to mitigate or suppress the transmission of this highly virulent variant.
I'm going to take Dr. Cole, if you want to go ahead, I do want to.
I was just going to say a couple of things. One was just to acknowledge the conversation that took place earlier about hospitals and the experience of hospitals. The numbers don't tell the full story because the numbers look like we have sufficient beds, but we have staff in the hospitals who are out with COVID now and who are at home and can't get into work for a variety of different reasons, and that changes the calculus about how hospitals manage. So, and I think that's a message that hasn't fully gotten out in a way that perhaps this will begin to help do that. The other piece of this is that would argue that we are working continuously with MCPS and to talk about how we message to the community about the impact of COVID on the staffing of the schools and the ability to provide in-class instruction and in-person instruction in a safe way. And I think that it's theirs to message, but certainly we are working with them to try to make sure that they're clear about what it is that they need to message to the public in relation to the virus. And then I think the last one, I'll turn it back over to Dr. Stoddard, because I think there are fire and rescue and police and other areas where messaging is taking place that he's been a better place to talk about.
Yeah, I think that we've got to communicate this more, because what I've seen a lot on social media in commentary, not just from parents, but for all kinds of services being accessed, is this perception that we're in the same kind of situation we were in 6 months ago. What I mean by that is when we had a deficit in a particular area before, okay, let's backfill it with this other thing that we had that's maybe not active or something along those lines. That is not the situation we are in right now. And I think we need to be very clear that we would love to do more. There's always a request to do more of this, more testing, more contact tracing, more whatever service. The school system with the bus drivers. We've had to take kids to school, drive them as well. I understand that. I realize it's easy for me to do. It is far more difficult for many, many other families. I totally appreciate that. And I understand how debilitating that is to the ability of those children to get educated. But to expect that every institution can just cover up or paper over massive staff shortages one area, when all the staff shortages are being experienced across the entire system. And so I think we just have to be a little bit compassionate about just sort of there are massive impacts going to be felt by Omicron. There is no papering over those. There's no band-aiding them with one service into another. There's some triage that's going on to figure out exactly what we can stop doing to be able to support something that's an important service. But we are going to have a very tough next 3 to 4 weeks minimally. I think that's sort of what we're expecting. And there will be no covering up. We can cover up some of the worst of the issues, but there will be no, we're asking the National Guard to provide bus drivers. I want to let that sink in for people. That is not something we would do under normal circumstances. These are not normal times, and to expect that we or Ride On or or the school system are going to be able to paper over some of these issues is just an unfair expectation to have. Whether it's the public sector, their private sector businesses closing for similar reasons. It is unfortunate. It is going to be painful for us and for residents, but it's just a reality of the situation we are in right now. Something like, Dr. Scott Gottlieb, who is not a, liberal pundit, he's a former FDA commissioner under the Trump administration, has said he expects 30 to 40% of the population to be infected with Omicron for this wave. We are seeing a significant level of infection. I think it's just so important that people understand that there will be no band-aiding some of these losses, and there's going to be pain felt. And I don't think we're trying to avert the worst of those pains, but there will be pain felt.
Empty shelves in supermarkets due partly to the staff shortages as well. And so I appreciate that, Dr. Stoddard. I believe firmly that we have to be absolutely realistic in our messaging because there's, as you said, no way to sugarcoat this. The last wave, we were worried about the infection. We didn't have the availability of vaccines, and that's why everything kind of shut down for a while, et cetera. The idea was to protect people. Now everybody has been out, et cetera, and folks are being infected, and it is causing folks to have to stay home, of course. And so this notion, almost this fantasy that somehow we just need to solve our so-called philosophical differences and everything will be, done. It is absolutely impossible. There is no way that we will be able to provide those level of services as folks expect. And we need to be able to, in my opinion, be more forthright in our communication about that, so that as we're going through this very painful period, which hopefully will, only last 3-4 weeks more, keep our fingers crossed, that everybody understands, yes, we're frustrated, but it's also a reality. The bodies are not there. The teachers are not there. The staffing is just not there. And therefore, we all have to come together and work through this. So I implore, especially our communications folks, to begin to work strategically on this kind of messaging as soon as possible. And let us all amplify that as well. Thank you so much.
Councilmember, thank you. It is, we don't talk a lot about the staff in this process in some ways. And having just gotten notice of 2 more resignations from the department this morning, along with the 100+ people who are out with COVID right now in the department. Folks are tired, folks are exhausted, and in some cases, folks have given up. And we've got a lot of folks who haven't given up and who are still standing strong and standing tall, but they are tired. So the message around patience and understanding that what is affecting the public is affecting the staff, and we don't have bodies standing in the way that we can move from one place to another place. This is now going to be tough for the next month, and we will get through it, but it's going to take some time. So I appreciate your thoughtfulness in the words.
Thank you. And in closing, I would be remiss if I didn't give a shout out to the folks working at the Civic Building. I went to get a PCR test last Friday, and I was so extraordinarily moved by their sense of duty, professionalism. There were a lot of bilingual staff there, and so I was watching how they were serving everyone, and it was just extraordinary. So have to give a shout out because folks are still there doing their work, being exposed, but doing their work with full hearts. So thank you.
Thank you, Councilmember Novato. Councilmember Jawando, and then after Councilmember Jawando's questions and comments, we will formally introduce the public health order at the request of the county executive and engage in a Q&A with our colleagues in the executive branch.
Thank you, Mr. President. You're running a tight ship. It'll be done by 11. This is great. And good morning to everybody. Thank you as always. I have a little list here so I can stay on time. The libraries, I'm lead for libraries. It was such a joy to be at Praisner, and I swung by only to help pass out some of these test kits. To Councilmember Navarro's point, we could all look where we were a week ago. People were pulling their hair out, freaking out. We didn't have any tests. And I got a message at 12:11 a.m. this morning from someone I don't know who just said, grateful for the tests I was able to pick up for my family today. The line was with a lot of O's long, but it went really fast and was easy. Thank you to the council and all your staff in the county. I think we just have to remember that we are all working very hard in responding as quickly as possible. And I think yesterday was a great example that we are doing what we can. And it didn't just happen. The test didn't just get there. Dr. Stoddard and the executive branch, they were ordered months ago. Work had happened and it didn't come when we wanted, but we got it up and running. And I just want to kudos. It reminded me why I'm happy to be serving here in Montgomery County, and to all the people who physically did it. Thank you. I gave out a few hundred, but 93,000, that's a great number in one day. To the MCPS frustrations, and I start with that because I kind of feel like we need the old London sign, stay calm and carry on. I mean, we've got to remember that this is extremely difficult. Every teacher, every educator, every bus driver, when I put my kids on the bus this morning, everyone wants our kids to learn and to be safe and to be healthy. Everyone wants that from every side of this debate. We all want that. No one's trying not to achieve that. And but it's hard because we've never dealt with anything like this. These staff shortages are real. People are stressed out. The sermon in my church this weekend was that we're running on empty. The gas tank is empty. And how are we going? It doesn't feel like a new year. We're just continuing. It's Groundhog Day, and the tank's still empty. And so many of our folks feel that way. And so, to your point, Dr. Starter, my question and expectation setting is, I want to ask, based on what we are looking at with the spread, those numbers you talked about, 40, 50%, and the staff shortages we're seeing. And I know the MCPS isn't here, but in your opinion, and anyone can address this, are we going to have to consider going to virtual schooling at some point because of the range of these concerns? Realizing no one wants that. I want my kids in school. We know that it disproportionately impacts certain communities, but where we are, just realistically, is that going to be something that we're going to have to deal with over the next several weeks?
I don't know. I'm sure everyone's going to want to comment on this. What I expect is our strong preference to keep kids in the classroom to the extent possible. Now, I will tell you that I would expect that there are going to be more than just these 11 who have to convert because of the staffing issues largely driving them. Now, there's been a lot of commentary that there's massive transmission going on in our schools. What I don't actually think that's actually what's happening. I think we're detecting community transmission that's occurring in the community when the students and faculty are reporting to school or through the tests that we're providing them via the school. But I mean, I'm sure that there is there are cases where school transmission has happened. I'm sure that it does happen. I'm not denying any of that, but I think to be realistic, I think we prefer not to make a system-wide decision.
Sure.
But the staffing issues could certainly get us to a point where more schools, and even under some extreme circumstances, it could become necessary. What we've largely said is, as long as schools are incredibly no greater risk than the community, but that also includes supervision by adults who are teachers and provision of education, then we're going to try and keep them open. But obviously there are limits to that.
Before you chime in, Doc, and I do want to allow this, I just want to make this point. You're bringing up there's a lot of factors to consider. I've been in talks with the MCPS superintendent and the general counsel about this opt-out, opt-in. If we could test more people in school, we can use a scalpel as opposed to a broad policy and shutting down the whole system. So that's a thing the governor and the director of health has to give us the ability to do, and we're working on that. But you bring up a good point that staffing shortages, all this plays together. And obviously we want to scalpel, but we have to recognize where we are. Dr. Kroll, and then I'll turn back.
So I would just add that what we are seeing, this whole process began during the winter break, when MCPS asked staff, parents to voluntarily send in their information about what was happening with their children during the break. And we got to those numbers that you all saw at the start of the school year during the break, but not in-school transmission. Having been back in school for several days in the week, we are seeing that there's some uptick in the number of positive cases, but that it's partial data and it's incomplete. What we are doing is using the system that we were using before, plus I think rapid testing adds a new variable, a new way for us to track that and to manage those cases. The big issue, as Dr. Stoddard points out, is does the school have the staff and the capacity to get students safely to and from schools and to educate them and keep them safe and socially distant while they're in schools.
And school health too.
And school health, yes, and our school health. Let me not forget that our school health staff are also being affected by this in terms of their capacity.
We just need to be honest with people why we make the decisions we're making. Yes. And if it's staffing, if it's this, we just need to no sugarcoat, no chaser, as they used to say. Just tell people exactly what's happening, and I think people will understand that we're dealing with difficulty. But I've
had a couple of conversations, and we'll have some more conversations with joint conversations with MCPS around that and around messaging. I think the messaging is hopefully getting clearer. You're right, straight no chaser. We need to let people know what the story is and why we're making the recommendations we're making, and why MCPS is making decisions about whether or not they close classes within schools, close whole schools, and hopefully not, but close the whole system down. I don't think we're there yet. We have some other things that we can do to help support in-person learning, and we want to try to keep that going as well as best we can.
And the only point that I will add is that we're looking at other models. We spend an enormous amount of time looking at New York. And New York use a surveillance data approach. So as Dr. Stoddard and Dr. Kroll indicated, there are other metrics that we're looking at that they articulated that, due to interest of time, I won't go in, but we will be transparent and look at the data analysis and share that data, because we know that most of the outbreaks that are occurring are community level versus school level.
Yeah. Thank you. Thank you, Mr. President.
All right, thank you all so much. I'll remind my colleagues, our friends and MCPS will be joining us on the 18th, and they are having their own town hall on Wednesday, which I know Dr. Bridgers will be participating in, and that will be another opportunity for the community to be heard and for hopefully a dialogue to ensue, because that is obviously a critical issue and has so much fallout. I was talking to somebody the other day, the pickup and drop off at schools, because buses aren't available, have become immensely challenging, and so there are so much fallout as a result of this. So I appreciate everyone's comments. All right, we are next going to move on to item B on the agenda, sitting as the Board of Health, and I will now formally read. This is a resolution to adopt. Apologies, we've got some work going on upstairs. Resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county. Vaccination requirements to enter bars, restaurants, recreation centers, and other covered establishments. The lead sponsor is myself at the request of the county executive. This, for our public, and I know there are many tuned in, apparently, watching through YouTube today, who I know are very interested in this topic. I'll remind the public we will have a formal work session and invite key stakeholders, particularly in our private sector, who will be the most responsible for carrying out this public health order, to ask questions of them and discuss the operational impacts and see what, if anything, can be done to amend the order to reflect the change that's needed. I'll also just note a couple of things on the front end. This obviously follows what several cities around the country have moved forward, and several cities around the world, otherwise known as the vaccine passport, the most high profile of which is in New York City, and the District of Columbia is enacting their own version of it on the 15th. But we, as we always do, will be cautious and ensure that what's best for other cities still works here in Montgomery County, recognizing the stark differences between cities and counties that are urban, suburban, and rural, and have their own unique elements. So we look forward to this discussion. I know several of my colleagues have formally submitted questions of our colleagues in the executive branch, including myself. I hope that you'll be in a position to answer at least some of them today, but hopefully in a better position as we move forward with the ongoing discussion as well. So with that, Ms. Wellens, I'm going to turn it over to you to just briefly describe the order for my colleagues to set the context with more specifics. And then I will ask Dr. Stoddard or Dr. Kroll or whomever or Dr. Bridgers from the team to make some comments on behalf of the executive branch. And then I will call on colleagues in the order that you all text me. Councilmember Friedson will be first up. He has already texted. So with that, Ms. Wellens.
Thank you very much, Mr. President. And just to note that in addition to the work session where stakeholders will participate next week on the 18th, in addition to that, the public hearing is also scheduled to occur that same day. This resolution, as you said, it's similar to some other jurisdictions in the District of Columbia in particular, would adopt a Board of Health regulation that would require certain businesses and organizations to require that individuals entering them provide proof of vaccination in order to do so, and specifically restaurants, bars, fitness centers would be covered, gyms would be covered. A number of facilities would be specifically exempt from the requirement, including healthcare facilities, including grocery stores, including including libraries, including facilities where individuals are accessing essential services and essential services from the government. Those buildings would be exempt. In addition, certain individuals would be exempt from the requirement. That exemption would be twofold. First, if the individual is entering for a very limited short purpose, such as picking up takeout from a restaurant. And then in addition, individuals who are entitled to medical or religious accommodations would be exempt from the requirement as well. The resolution would take a phased in approach, meaning that as currently drafted, January 22nd would be the first date at which individuals entering the covered facilities would have to provide proof of one dose of a COVID vaccination for individuals 12 years and older. Then effective February 15th, an individual would have to show proof of full vaccination, meaning, the 1 dose of Johnson & Johnson or the 2 doses of the other vaccinations. This would not include boosters. And then effective March 1 is when the regulation would take full effect, and all patrons who are 5 years and 1 month old or older would be required to provide the proof of vaccination. And I would just note, Mr. President, that I think part of the work session, it will be important, among other issues, to make sure that we really clarify which organizations are covered, which organizations are not covered by the scope of this order. We have had some questions from municipalities already asking for clarification. So again, obviously, I'll be discussing a number of issues, but just wanted to note that. Thank you very much.
Thank you. Turn it over to the public health team, whoever would like to begin to give some comments or background.
I'm happy to. Oh, go, Dr. Burge. You go ahead. You missed the session earlier. You get to go. Go ahead.
Yeah, no, we can share the wealth, as they say, in looking at this vaccine passport, if you will. We've had multiple discussions even prior to leading up to the submission, and we've had done extensive research and looking at those other municipalities where we see the efficacy of a vaccine passport. We know that individuals travel either inter-county, interstate, internationally, and there may be instances where individuals are asymptomatic. And identifying those individuals who actually can demonstrate that they've been vaccinating and creating a safe place, if you will, outside of testing every patron who comes into one of those establishments as enumerated in the proposed legislation. Those individuals would be able to now present evidence that they've had some form of vaccination. And we know that some form of vaccination can begin to increase the body's response to any other variants. And if there are any other variants that are forthcoming, or variants of concerns, or variants that are emerging. So this is some of the background information that we put in time to craft this proposal, to look at creating safe spaces where individuals can, even if there's a mask mandate or not a mask mandate, to be able to enjoy those establishments and in a safe environment. So that's some of the background data. It started when Dr. Gales was here, and we continue to do the research. We looked at peer-reviewed journals to look at the efficacy and the importance or use or utility of vaccine passports. So I just wanted to share those comments this morning.
The only thing I'll add, and this is just 30 seconds, it was drafted when originally Dr. Gales was here. We didn't do several meetings with businesses at that time to discuss with them. And largely the feedback we received was it was newly enacted in New York City. It was something we thought was a good idea. But we didn't have great information about how it was going to work in New York and other places. Since then, obviously, we've had a number of cities come on board, all within the last sort of 3 weeks or so: Boston, Chicago, Philadelphia, and most recently DC. And obviously, once we had a large regional neighbor who was enacting a similar policy, we thought it made sense to move forward with something that we thought had been a good idea for a long time. And so obviously, with the alignment of those things, the district coming on board, as Ms. Wellens clearly noted, we have clearly paralleled the district's order for regional consistency, as we've all sought to do throughout the pandemic where possible. And so I think that sort of gives you the background on what the intent and background on the development of the proposed Board of Health regulation. I would also note that Ms. Kinch is here, and she helped obviously draft this and has been looking at the way that it's been enacted in other places, and sure we'll be able to help describe hopefully some of the who qualifies and who doesn't based on the language used, how DC is interpreted, and how New York and other places have interpreted as well.
Thank you for that background and context. I just have a couple of comments and then a couple of questions. So I guess the first comment is, now private businesses can do this now, right? They can require a vaccination mandate in order to be able to enter their private business, irregardless of whether or not we pass this order. Is that correct?
Yes, some have done it. There are a number of feeders, AFI and others in Silver Spring that do it. There are a number of restaurants in the county. The Chef Andreas owned restaurants all do it, I believe, across all of his operated facilities. Hank Needles in Rockville also does it. There are a number of that have already privately enacted.
Got it. And you know, a sit-down restaurant is one thing where you're at a location for an elongated period of time. You're interacting with the waiter or waitress one-on-one. But do we have any information on how this has worked with fast casual restaurants or places of business that have high volume? And how do we have any information on how that has worked?
Yeah, I certainly will, if Ms. Kinch has some additions here. So the way it generally would work is obviously you come into a fast food establishment, you at the register you say dine in, dine out, right? And if you are going to dine in, that's when they would ask you for a proof of vaccination. But if you wanted to just take out or leave the restaurant, you wouldn't have to provide that proof. Now, obviously, there are people who may say, I'm going dining out, and then they go and sit down. The way we have viewed this, and certainly, we could add clarifying language on this, is that if the restaurant makes a good faith effort to ensure that the person is vaccinated by asking them a question, there wouldn't be a risk of a penalty if someone then provided incorrect or misleading information that led them to believe they were leaving the restaurant. Ms. Kinch, I don't know if you have additional.
What I would say, thank you for your question, Council President, Mr. Albornoz. What I would say is that in New York City, just like our proposed order, as well as in DC, fast food establishments, cafes, those kinds of places are exempt from this type of requirement. Of course, when you have a facility that, for instance, let's say a fast food restaurant where a person is going to go in, get their food and leave versus stay for a long period of time, could pose issues. But New York, at least, appears to have some good examples of how to deal with those situations, and they did not appear to really encumber a lot of trouble enforcing this.
And then I guess I'm stating the obvious here, but we acknowledged in the previous update that 2 dosages now is basically an expired vaccine passport, kind of going into this. And if we are going to ensure the efficacy of this initiative, it would likely have to include boosters. Yet, I think it's last check, this was Friday, I can't remember what the exact number is of people who have actually been boosted. We need that number to go up for sure, but the number is significantly lower than people that have received both dosages of vaccination. So it is, I'm not going to take a stance on that right now. I'll just point out again the obvious, that if we're going to do this, and it is a big if, I mean, there are a lot of questions that we have to sort through here on logistics and all of it, then that is something we're going to have to note. Otherwise, this is just a symbolic gesture at best, and not one that actually has true public health validity or efficacy. I do have one final question before turning it over to colleagues, and I see several other colleagues. I'll announce the order when I turn it over to Councilmember Friedson in a minute. But has there been a track of, has this, can we definitively say that These orders that were enacted in New York and the other cities, it sounds like, have enacted them more recently. But have they worked? The spread issues are significant. I mean, one potential data point is the number of restaurant employees that have gotten sick. That could be a data point that we may point to, because they are certainly on the front lines and being deeply impacted by all of this themselves. But do we have any data or information on whether this actually works?
So there's a couple of different ways to look at how things work, and I think Ms. Wellens, even in the council packet, I assume it was Ms. Wellens who prepared the council packet, did note that in New York City they saw a 9% increase in vaccination in the weeks following, above what they would expect. So obviously, if your point is well taken, that if you're looking to encourage boosters, inclusion of them would certainly encourage more people to go out and get them to continue to be able to do things that obviously would be to their benefit. Now, I'll have to go back. There were a number of data points that were looked at. We certainly can provide those about the actual impacts that they saw in their data for restaurant infections or contact tracing tying to restaurants. We can certainly provide that. I do believe they saw a reduction, but I don't want to just comment anecdotally based on things I haven't looked at in certainly many weeks. But I would be happy to pull up. We can ask the EPI team to pull that data and provide it to the council.
And just to add, Council President Albornoz, and looking at the data, although the Maryland Department of Health contact COVID link has been updated since the 1st of January, restaurant and places of business as such still continue to be the top 5 places where we're seeing exposure. And so, as Dr. Stoddard indicated, we will follow up with our EPI team just to get more recent data to see if there's any cross-referencing for data points to demonstrate the efficacy.
Thank you very much. All right. We've got Councilmember Friedson, followed by Councilmember Navarro, then Councilmember Reamer, then Councilmember Jawando, and Councilmember Rice. And we are going to try to get through this before we break for the recess in between. And this won't be our only opportunity to ask questions. So I just respectfully ask that my colleagues have targeted questions if they can. Councilmember Friedson.
Thank you very much. Appreciate this conversation. Appreciate the process that we have laid out to start today. Have stakeholders next week in a public hearing, and then to take this up. It's a very sober and serious conversation that we need to have. I'll just start by saying none of this conversation is a question of whether or not vaccines work, because undeniably vaccines work. It's a question of whether this is the best tool and whether, as proposed, it is an appropriate tool in order to remove the needle in a sufficient way, and what the cost-benefit analysis is, which I think is a very different conversation. I think it's important to say that from the outset. I don't think any of my questions or anybody's questions from this body, based on all the conversations that we've had earlier today and otherwise, are in any way intended to question the efficacy of the vaccines, which are undeniable. So that just from the outset. We were asked to send detailed questions in advance of today's conversations. I sent personally a dozen detailed questions. I was just wondering if the executive branch has had an opportunity to review those and whether we would be receiving responses to those questions in writing and at what point.
Yeah, so we had a review session. We've actually had a couple of review sessions and we've actually got a team working on answering the questions. So we have answers to many of the questions and can provide answers to all the questions in writing. Some of them obviously had some research associated with around the cost benefit analysis and things like that. That's based largely on what other jurisdictions have done. So some of the ones that required more research aren't finished yet, but we can certainly look to provide those by the end of this week.
Okay, appreciate that. You mentioned, speaking of extensive research that was done in drafting this and then determining whether or not this was an appropriate strategy. Do we have access to that research? Can you share that with the council and with the public?
Yeah, we could pull together some of the research findings that we had. I mean, many of them were, we didn't produce like a white paper based on the research. It was, often bringing data to meetings and that kind of conversation. But we certainly could pull up many of those data points to provide as part of, I think actually some of the questions that were asked referred to the data itself. So I think they would be included in the answers to that questions.
Appreciate it. I just think it's important if the Board of Health is going to determine whether or not this is an appropriate path to move forward, that we have access to the same research that the executive branch used to determine it. Similarly, with the stakeholders, you noted meetings with stakeholder groups. We've heard from a lot of stakeholder groups that didn't feel like they had been consulted or given a heads up about this. And so if you could provide us with the specific details of who was included in what meetings, when those meetings took place, and the result of those meetings with stakeholder groups, private organizations who are impacted by this, that would be helpful as well. Okay, just a couple or a few questions that I have. There's clearly evidence to suggest that one dose of the vaccine improves outcomes, not nearly to the extent that you have determined is sufficient at this point. I would agree with you on that. Is there evidence to suggest that one dose of the vaccine more than 6 months ago limits the spread to others?
So the data, that's a complicated answer. So if you've had a dose of vaccine, you are less likely to contract by some percentage. And if you're less likely to contract, you are less likely to contribute to community spread. Now, if you have coronavirus and you've been previously vaccinated, the data suggests that you are probably as capable or nearly as capable of transmitting to others. But because of that difference in the ability to contract, if you took a pool of people who were totally unvaccinated, a pool of people who had one dose in it, you would see slower transmission within the pool of people with one dose than you would others, because you would see a reduction in their ability to contract and then put on to others. Obviously, it's a pyramid. So you start with one person infected and you go down the pyramid to more people infected. If one of those people in that chain is that partially or fully unboosted, vaccinated, that will reduce the probability that they contract and therefore spread to people below them on that chain.
Okay. Why were employees specifically excluded in the covered businesses? Could you just explain from a public health perspective how residents are unsafe in an environment if they're unvaccinated, but would be safe if the patrons are at least one dose vaccinated, but the employees perhaps aren't? Could you just explain the public health determination that made that decision?
Sure. So, Dr. Bridges, I'll let Dr. Bridges speak. You want to?
Sure, Councilmember Friesen, thank you for that. So in any setting, be it this particular proposed regulation or any settings, we know that effective mask wearing is efficacious. And so that was some of the consideration that we took into that those employees would continuously wear a mask while others are unmasked. And so we've looked at additional data regarding the efficacy of that and what the other jurisdictions and or proposed or implemented vaccine passports described in that. And so we can provide additional data points regarding the efficacy of employees being wearing masks consistently and constantly and not being vaccinated.
Yeah, if you could explain that, that's a little bit challenging to understand, because if the mask itself is efficacious, then it would seem that we should be discussing a mask mandate that we discussed last week, not a vaccine passport.
Councilmember Friesen, I'm sorry. A restaurant is the one place where a guest cannot keep their mask on and do what they came there for. A staff member can keep their mask on during the process of doing the work that they're doing. So it's a very simple. It's the math. The process is very simple. I come to a restaurant, I have to take the mask off to eat, and that raises the risk of transmission and exposure. Versus wearing a mask as an employee is something I have to continue to do. The other piece of this is that employees are also consumers of service and restaurants in the county. So if they want to go somewhere else and have a meal and eat other way, this would also require that they have that passport in place as well for themselves. So that also would work to increase the number of folks who are perhaps getting vaccinated.
Appreciate it. Okay. As proposed, this has no end date. How long does the executive branch and the health team recommend that the passport requirement remain in place, and what are the specific objectives and metrics that would be used to determine whether or not it's effective?
So I think Dr. Bridges referred to this a little bit, to the contact tracing data that is provided to the state that looks at locations where this would be implemented, which are, restaurant, not retail, recreation gyms and fitness centers are all categories that you would expect to see reductions in the transmission in those places with the implementation of a vaccine passport. And so those would be the metrics that we would utilize, the COVID link Maryland Department of Health data that's provided to the counties that looks at contact tracing data for locations where people contract COVID-19. And so I think that we would look for, I think the overall sustainment of the regulation would be largely based on some community transmission metrics that that could be developed or would be similar to things that are otherwise in place for other orders, like even the mask mandate itself.
And just to add to Dr. Stoddard and to Dr. Crow, Councilmember Friedson, so in looking at those individuals who are patrons but who may be employees, we're also looking at data that clearly demonstrates that those individuals who vaccinated may have a lower viral load, especially those individuals continue to receive their boosters. So if in fact they're employees but they're patronize other establishment, that would add to the efficacy of having such a passport to mitigate any further risk or suppression of the virus. But we will provide data points regarding that and what the most current data and science are saying around vaccinated versus unvaccinated, as Dr. Stoddard indicated, in those business establishment or other places as proposed by the regulation.
Well, that information would be really helpful. I'd just say back in August, the county executive first began discussing, at least from my recollection, the potential for a vaccine passport. It could have been mid-July into August. It was around the same time that we talked about an employee vaccine mandate, and continue to have that conversation today, whether or not we're going to require of our own employees what the county executive is proposing that we require of patrons of private businesses. At that time, I suggested to the executive branch that rather than having a requirement legislated, that the county executive back in the summer, could have shown some real leadership, both regionally and with our private businesses, to create a portal, a vaccine passport, a voluntary opt-in vaccine passports for businesses, providing all of the back-end work that would be needed with technology that is available, would pay for it through county resources, would really make a push to private businesses for them to opt in, would have a branded effort throughout the county, and even invite other regional jurisdictions into our vaccine passports to see if they'd want to join in as well, and provide those businesses with the tools, the resources to keep residents safe, to keep their customers and their employees safe, and do it as a positive, recognizing that we have this challenge that we are facing together, and we could bring stakeholders together in order to address it. So I am wondering what, if any, conversations took place back in the summer and into the fall to move forward with this on a voluntary basis, to talk to stakeholders, to determine with resources that at that point were available and continue to be available, what, if any, conversations or progress was made on that before this determination after DC moved forward to decide to propose this Board of Health regulation.
So one of the big things with the portal is that the state has thus far declined to allow portal systems to access the data for vaccinations. And so we would prefer that there be an online system other than the MyIR system. The governor's talked about adding a QR code to the MyIR system to allow this to happen, but so far it's not happened. But thus far, the state has declined to give access to the database for any web developer who wants to develop a vaccine passport utilizing the data. In fact, the conversation that we led actually led the Maryland Department of Health to say that some of the things that have been done with previous accessing of that system was inappropriate, and they were actually reviewing some of the previous things that have been done. And so obviously that sort of precluded that voluntary system. Now, obviously some restaurants have gone ahead and done it themselves. What we've heard in feedback, though, and I think Mr. Weissman, my colleague in the county executive's office, has been really meeting with businesses to talk about. One of the common points of feedback that we've heard is they have a hard time committing to doing this, knowing that their neighboring competitors, in most cases across the street, are not going to be doing it, and they're concerned that they're going to be driving business from one of their locations to the other. And they said if they want, they said they don't have, some businesses said they didn't have an issue with this per se, but they didn't want to enact it unilaterally because of the impacts they would see in their micro environment of where they were implementing it. And so that was sort of one of the big considerations for the idea that, if we're going to do this, doing it, this is the same reason we, have decided that we shouldn't just trust people to do the mask requirement. We've said that there's going to be a mandate because, it influences more than just the one person who decides to do it. And so that sort of gives you some background there around. We did try and we would still be interested in developing an app, and we would develop an app, which up until this point the state has declined, and we have in writing their declination that they do not wish to have the data be accessed for this purpose.
Well, I want to be respectful of other colleagues who have, I'm sure, a number of questions here too. I have a lot more questions, or several questions that haven't been able to be answered, which I hope we'll get to, as you noted, by the end of the week. And I would really push for the implementation questions that I had and the technology that you intend to deploy. And just speaking to the response you just gave, honing in a little bit more and understanding how we lack the ability to have an opt-in system because the state won't allow us to have access through a portal to vaccination status, but we do have sufficient technology to have a requirement. I think that requires further understanding. And
there is no technology that's required to have a requirement, though. You can have a vaccine card that you have, or you can take a picture of your vaccine card, or anyone can access the existing MyIR system to print out a copy of their vaccine record. And so there is no technology. The technology is supportive. It's not a requirement for any of these processes. And most of the places, for example, New York City's app is just you take a picture of your card, and that's their app. So
well, I guess my point is if the technology is available for requirement, it certainly was available, even without the state's cooperation, which is unfortunate. I would agree, but to have had an opt-in system at a time when we were trying to push more people to get vaccinated, which is one of the stated goals here in a place where we have, 95%, according to the numbers you gave us earlier, of residents who have one dose or more. But I'll yield back to colleagues. I appreciate the thoughtfulness here, and we'll go through the legislative process and determine how best to move forward. Thank you.
Thank you. Councilmember Navarro.
Thank you. Actually, I wrote some questions, and Councilmember Friedson had pretty much asked my questions, but very interested in the notion of the criteria that we are utilizing for identifying which establishments. I would like to, definitely hear more about that. Also, the notion of the updated engagement with stakeholders. I heard Dr. Salas said that there have been conversations in the past, but obviously we're at a different time now in terms of our vaccination rates. But would like to know if there has been another effort to engage and to hear their feedback. Also the piece around what will qualify. So is it a photo on your phone? Is it going to be the actual physical card? That is something that I would like to understand. And then in addition to DC and New York City, would love to hear also what other jurisdictions similar to ours. I mean, it's pretty obvious that DC has a very vibrant restaurant and nightlife scene. New York City obviously does as well. We have some not at the same level. So just understanding jurisdiction like ours that tend to be more of a mix between, mostly residential, some activity centers, et cetera, but not full-blown city restaurant and nightlife scene, and to look at that data and see what actually we have been able to gather there. So those are some of just mostly logistics in nature, just to kind of understand how would this work, and what is the data that you have seen. That would be something that I would like to have once we get into the actual work session regarding this particular mandate.
Thank you, Councilmember Navarro. We will definitely make a note in the notes to follow up on that request. Councilmember Reamer.
Thank you so much. Appreciate many of the questions that were raised. Council President, you touched on an issue that I wanted to ask about the efficacy of the requirement. Given we know that true efficacy comes from boosters. Does the draft refer to full vaccination as defined by the CDC, or does it refer to specific numbers of doses? In other words, forgive me if you said this already, but if the CDC were to change the definition of fully vaccinated, would that translate through in this order? And then that is the requirement, or would we then be out of sync with that? Can you just talk about that issue, please?
Yeah, so right now it parallels exactly with DC, which is a 1-dose, 2-dose timeline. I think it is entirely appropriate, and I think the public health team would support the addition of a third timeline for a booster, or even utilizing the second timeline for all, for what we think would be a great idea. We largely parallel DC because of the desire, long-standing from the executive branch as well as the legislative branch to parallel our regional partners. But I do think that is an addition that would be a very worthwhile addition, because obviously part of the intent of any kind of vaccine passport is to encourage people to do the thing that you're requiring that they have done. Then boosters are the thing that would, and obviously early childhood vaccination, all those things, that would certainly be the thing that would most notably. Now, I will tell you, boosters will be a little bit more difficult to implement because not everyone is eligible for a booster. So when you're reviewing a card or looking at a printout of a card, there will be a little bit more work that had to be done by the particular establishment to verify, is this person actually eligible according to their card for a booster, and is that reflected on their card? And so there are logistics associated with having a booster requirement, but from a public health perspective, it is certainly a worthwhile addition to have on there. Not currently reflected in the draft.
Sure. And just to add, Councilmember Reamer, so public health will continue to monitor the CDC guidance regarding their definition of fully vaccinated and boosters. And then if it's the council's will and this proposed regulation is adopted, continue as we've done with indoor mask mandates to make those recommendations per guidance or any policies or decisions that are made going forward. So we are prepared to make those necessary adjustments as we're doing now, absent of this regulation, but looking at those strategies to increase vaccination, as you indicated, in the county.
Thank you. Secondly, I would just like to issue an urgent plea that we remove the word passport from our lexicon here. Your average person hears the word passport and they think that there's some new document or maybe there's some new app, and there is not. This proposal is that you would show your card or a photo of your card, and you don't have to become expert in some new technology, and even if you do lose your card, you can always get a reprint of your status. So let's please, drop that word. It creates confusion instead of clarification. Just as an aside, my wife showed me her grandmother's vaccination card for polio from the 50s. It's been passed down. Amazing how, in some sense, similar it is. But so
Councilmember Reamer, just to add to that, that's a great personal story. I know that I looked at some data where individuals still had their passes for yellow fever. And so in some of the literature that I read from Yale, they used the term COVID passes.
Okay, well, I don't know. I think everyone is familiar with their vaccination card. And I think the idea that you have to show your card or a photo of your card is something that everybody can understand. And so I would just encourage us to try to keep within the bounds of what people already know. The state database is a backup. So you don't have to panic that if you lose your card, you're shut out. But next point I want to make, I just had the opportunity to spend a couple days in New York over the holidays. And, I had, as a result of that requirement there, I had to show my card, to eat in, and I dined in multiple restaurants in New York with my family, at a time when we also knew that COVID was peaking, and we're vaccinated and as boosted as we can be, and we felt confident that we could indeed do that. And the requirement, I think, frankly, improved our confidence a little bit that it might be more safe. I think we are generally confident in the vaccinations, and I think we should all be generally confident in the vaccinations. The data on your risk level once you're fully vaccinated is so overwhelming. It is just so utterly overwhelming how much safer you are, and frankly, how much safer you are than when you're unvaccinated, and then you can begin to really compare it to other risks that you confront in your daily life, and recognize that being vaccinated is the answer. And I can see how this proposal is part of that. It's part of stressing the importance of vaccination. That's fundamentally what it achieves. And I'm heartened to hear that there was an increase in the vaccination rate in New York after it was enacted, because I've wondered, frankly. There are some major kinks in this one. There's no question. I'm very concerned about the potential for businesses to have to deal with those claiming an exemption. That sounds very complicated, or any number of other issues. But there's a positive possibility here that in a community that is highly vaccinated, that believes in the vaccinations, that where yet many are not yet comfortable, coming fully out into the public, that it increases confidence and it leads to more normalization. That seems like a positive possibility from this proposal. So we will just need to weigh all of these carefully and give serious thought to how to approach this challenge. Thank you.
Thank you. Councilmember Rice, followed by Council Vice President Glass, and then Councilmember Katz. Councilmember Rice.
Thank you, Mr. Council President, and I'm going to try and be quick since a lot of the questions have already been asked, but let me just make sure that I understand. A person who is vaccinated and boosted sheds the virus at a smaller amount and for a shorter period of time. Is that not correct?
That's correct. Go ahead, Dr. Stoddard, based on the data that we're seeing, but there's also challenges with breakthrough cases.
Yeah,
absolutely. So
that data is a little softer, I would just say. You're certainly 5 times less likely to contract, but the data on transmission is not quite that significant. But if you have a vaccinated person in a room, you should feel a lot better about that person being in the room than the unvaccinated person, without question.
So I think that's again, just to kind of understand the spirit of what this is, we're trying to keep as many people safe as possible. So encouraging in a room where you're going to not have a mask on for a prolonged period of time, you want to try and reduce that likelihood of transmission as much as possible. And that's what this is truly about. So I just want to be very clear from that standpoint. I do have questions when it comes to, again, the quote unquote policing of vaccine cards in terms of what the demand is. Dr. Stoddard, I appreciate what you said, in that as long as a venue has a good faith effort, I would just, whatever we end up doing, I would just like to encourage and remind folks that regardless of whether there's a vaccine passport or vaccine card proof that's required for entry, does not mean that you should still let your guard down, that you still need to be mindful and still wear your mask and still continue to protect yourself as greatly as you possibly can, because just as we have heard, and I personally have seen, wearing a mask and being vaccinated and boosted does not mean that you will not contract the virus. So that is really important for our public to hear and understand. However, reducing the percentage and reducing the likelihood is also equally important. And so my question is, along the lines of where our target audience should be. We've talked about restaurants, we've talked about some of our other entertainment establishments, but I want to be clear. Are we talking about houses of worship? Are we talking about what's the, and I know that's not listed in terms of what you sent over, but it is something that I think we need to be very clear about, and why we're targeting the certain places that we're looking at when it comes to the higher, what we perceive as higher risk, which means that we need to try and enact a higher level of protection or reduced level of exposure.
Yeah, so I'll start, and I think maybe Ms. Kinch may have some comments on this as well. I think that obviously we've largely aimed to parallel, and if you look at those 8 organizations that are entities that are covered across all the programs that are similar to this across the country, they all are targeted towards the same businesses. They're largely the businesses that you see at the top end of the contact tracing data platform that also happen to intersect with places where face coverings are either more difficult to wear, as in the case in fitness centers, or not worn by practice, like a theater where you're consuming food, a restaurant where you're consuming food, etc. And so those were largely.
Dr. Sutter, can I just stop you there, because I think that's a very important point. So you said at the top of contact tracing, and also when it comes to where we see face coverings that may not be worn as much of the time that the person's in that establishment.
Correct. That's sort of the basis for what universally these programs have. That's why they look so similar in terms of the types of establishments that are covered, and frankly, largely the houses of worship, for example. I think people have generally wanted to give deference around free practice of faith. That there's been less willingness to go down that road, legal and otherwise, for less public health reasons than other reasons. So I want to be clear about that. So there are a number of enumerated locations in the proposed bill, regulation, I should say, that are enumerated that this would not cover. And certainly that list that's certainly an area where I think some more definition would be appreciated. We actually added more definition from what the district has put out there based on the feedback they got from when they announced theirs. And so, but there's probably more opportunities for clarification around who it should apply to and who it shouldn't. But from a public health perspective, obviously, if you see more contact tracing data that supports it, and it's a location that face coverings are less worn and more difficult to wear in that setting, that's largely the businesses or sectors or environments where you see in the proposed program.
And if I can comment a little also on this issue also, Councilmember Rice, what I would note that given that the purpose of this is to encourage additional vaccinations, we did have to be concerned with ensuring that our residents are still able to access essential county services, as well as to exercise their constitutional rights to petition government, as well as seek your essential services, which is why in part you see that there are exceptions for public libraries, rental assistance, food assistance, etc. So that's part of the rationale for the exclusion of houses of worship, pharmacies for medical care, and certain other areas.
Well, no, I really just want to say thank you, and I think that those points are important as we look to continue the discussion around whether or not we move forward with something like this. I think that the primary goal in terms of what we're trying to achieve and why we're strategically looking at these places helps to guide us in this decision. So thank you very much. Back to you, Mr. President.
Thank you. And I'll just go back to Councilmember Reamer's point about eliminating, I'm not going to say the word, but how we refer to this order is important. And he's right, because that has been a lot of the questions about how that would work. Just, is there some new technology being implemented? There is not, and it's important to note that. Council Vice President Glass, followed by Council Member Katz. And let's, if we can, everybody, I apologize, try to wrap up. We still have to get through consent calendar and break for recess. Council Vice President Glass.
Sure. I will be brief, Mr. President, because our colleagues have asked the questions I had listed regarding the rationale and the mechanics for this proposal. But this proposal, similar to all the other measures that we have taken and are contemplating taking, reflect on the regional approach that we've adopted over the last 2 years, whether it is the mask mandate that we adopted last week, with the potential sunset for the end of the month. As it has been referenced multiple times during this conversation, the fact that DC has a vaccination requirement for most of their public places. But I had seen in media reports that the mayor of Baltimore has discussed the idea of a regional vaccine mandate for the large 8 counties in Maryland. And I'm curious what our participation has been, if those conversations have taken place, and what the executive team's thoughts are on a regional approach within the state of Maryland for this proposal.
So thank you for that question, series of questions, Council Vice President Glass. We've actually had conversations with the other jurisdictions, and the other health officers with the Maryland Association of County Health Officers have also looked at vaccine cards, vaccination statuses, or however we identified and named it, but also indoor mask mandates. And so we're looking at that now. We've created a matrix to identify those jurisdictions, to create a regional snapshot, because as I indicated in my opening remarks, we know that folks travel, folks often have similar policies and or regulations in place. And I will be following up with Dr. DeRaza, Baltimore City's health officer, after this call sometime later today, to talk about the very things that we're talking about this morning. And so thank you for those comments. It's very fortuitous, and we are having those conversations. I think Dr. Stoddard was going to add to that.
No, I was just going to say that obviously some of these decisions are both public health driven and also based on other factors, logistics, politics, what have you. So obviously having the conversation regionally, we 100% agree, and which is why we didn't propose this earlier, frankly, is that we wanted to see more on board. DC came on board, and it sort of made more sense to really broach this conversation in Montgomery County. But I think we'd obviously support, and we'll work, as Dr. Bridges alluded to, we'll work with our neighboring jurisdictions to see what we can get done regionally, and to the extent necessary, we would suggest paralleling what the region does. Should other jurisdictions show a willingness to really step up and do it. But it comes down to not just the public health guidance on what's safest and what's best, but also, there's some other factors that are being looked at.
Sure. Well, my simple request is to keep us updated on those conversations, getting the pulse of our colleagues throughout the state, because again, we all have shown a willingness to band together to protect our residents in the region. And for this particular proposal, I think we need to have eyes wide open, and we need to have the pulse of the region, not just Washington, D.C., the District of Columbia. So please do keep us updated, and I yield back, Mr. President. Thank you.
Thank you, Council Vice President Glass. Councilmember Katz.
Thank you very much, Mr. President. I too will try to be brief. Councilmember Rice did hit on much of the first question that I had is about how you decided on who would be on the actual list that would be covered by this and who would not. And I understand some of the logic, but if the logic is that the only way you could do something is to remove your mask, I understand that part. If the only way you could eat is to remove your mask, if the only way you could, do whatever, you have to remove your mask, go to a hookah bar. But if you're in a bowling alley and aren't you still required to keep your mask on if you're bowling? How does that work?
So a couple things generally bowling falls underneath recreation, and most recreation places you can consume food and drinks. Now, obviously, if a place, maybe I'm bowling here, but if a place didn't have consumption of food and drink while they were playing bowl, when I go bowling, I am typically consuming something. I'll say soda and pizza. So it depends on the way the environment is set up to operate. But also, we brought this up for fitness centers, because that was another question we had. Is we've seen. I mean, I can't tell you how many compliance issues we've seen with face coverings in fitness centers. They are very difficult to wear. As we all know, during physical strenuous activity, it's very difficult. I'm not saying bowling is the same way, but the way your body is moving, mask wearing is not great when you're playing a sport like bowling. And so, some of those things were considered. Now, if the council were inclined as the Board of Health to have allowances for places that did not serve food and drinks during some of those activities, I think carve-outs would be okay. But I think generally speaking, we've been inclusive because we know that those environments are not uniform, and many of them do have consumption of alcohol, food, and other things that would make them riskier environments.
And I appreciate that. And I understand if someone is eating and drinking, then they would be under the same rules if someone is eating and drinking in a restaurant. So I think that's one of the areas that we should be discussing. And the only other thing I ask is that if a person is exempt, do they get a card that says they're exempt?
No, not typically. But I will tell you on the exemption, because that was one of the questions that was asked by the Restaurant Association when we came forward. And New York City has put out very good guidance that the restaurants are effectively utilizing right now, because they've been doing this the longest. That obviously we would parallel. Should the Board of Health pass this regulation, there would be a parallel set of guidelines that we would develop based on the bill that would clarify some of the language around what the expectation for judging a medical or a religious exemption and what an accommodation looks like. Because I think people often say, I have a medical or religious exemption to any mask wearing. I mean, you can have someone who suggests that too. But a reasonable accommodation does not mean you travel and move throughout the establishment unfettered. In all cases, if there's an accommodation that can be made that protects the public and your rights as a person who is disabled, that is what a reasonable accommodation is all about. I'm sure Ms. Kinch could give more clarity on that, but to be clear, it's not necessarily you say, I have a medical exemption, I can go into the establishment as if anyone else could, or I have a religious exemption, I can, there can be accommodations that are made for those specific examples that vary based on the kind of facility or activity that's being offered.
Councilmember Katz, if you wanted me to add to that, I would just note that the tools that each business should use in terms of enforcing this are the same tools that they would use when there is a person asking to not wear a mask when they enter their establishment. So once a person identifies that I am unable to, either present proof of vaccination or to wear a mask because I have X condition or this is my religious belief, for instance, then the establishment is supposed to engage in a conversation with that person to see if they can reach a reasonable accommodation to determine how they can best access those services. So for some people, it may be for the vaccination pass, it would be, okay, you can wear your mask and come in for a limited period of time. Maybe you can't eat inside, but we can set up a table outside. Maybe you will be doing carry out. And really it's up to the business and the individual to work through if there is something. And if there isn't, or it would be unduly burdensome, for instance, a movie theater is not going to stream, movies so that a person can watch them at home without wearing a mask, then that would be unduly burdensome and the accommodation wouldn't be available. But it is the same tools. It's just a little bit of a different conversation based upon this particular requirement if it were to pass.
Well, I do believe that this needs to be another part of this conversation, is the burden that we are putting on the person who's standing at the door who says you are or are not allowed to come in, and how they could handle somebody saying, look, I'm exempt. Well, there's no proof whether they are or they aren't. And so that becomes a whole nother issue for this. As much as everybody wants everything to be as safe as we can possibly have it, are we being as safe for that person standing there who says you can or can't come in to this business today? So anyhow, I yield back, Council President. I do believe that we have a lot of answers that we need. And if I could ask, if any of the answers that you're sending back to any individual council member, if you could copy all of us, the public as well, obviously, so that we could all be aware of all the answers that are given, that would be appreciated. Thank you very much, Mr. President.
Thank you, Councilmember Katz. All right, this has been a good conversation. That was a good segue, Councilmember Katz, because the next work session we will have will be to interact with and talk to the stakeholders who are going to be most impacted by this and have to enforce it. So Councilmember Friedson and I were texting each other back and forth as we're wrapping up. You don't need to provide an answer now, but I guess there is just a general question about what the ultimate goal is. I know there are multiple goals, but is it increasing vaccination rates? Is it limiting spread? It doesn't sound like it's a clear and concise answer, which I understand. But in the next work session and discussion, if we can be prepared to just articulate that, and most importantly, articulate that to our public, I think that would be helpful, because that will dictate the metrics that we use to determine whether or not this was successful, if it is in fact enacted. So thank you all so much for joining us this morning as the Board of Health. We're just 15 minutes over, so we will get back to our general business here. The next item on the agenda is approval of our consent calendar. Can I get a motion to approve the consent calendar? Moved by Councilmember Katz, seconded by Councilmember Rice. Is there any discussion? Seeing no discussion, all those in favor of approval of the consent calendar, please raise your hands. And that is unanimous. So thank you all very much. I believe, let me confirm, I'm pretty sure we are now going to go to recess. Yes, so we are now going into recess. We will be reconvening at 1:30 for public testimony. Thank you.
Check out Central Farm Market in Bethesda with my good friend Mitch Berliner, who actually was also my first boss.
Welcome to Strawberry Land here at Bethesda Central Farm Market.
It's the busiest market